Okay, you're all set.
Okay, terrific. Thank you. And good morning. We do have a quorum of members present. So the New York City Board of Correction, January 11th, 2022 meeting is now in session. Our first order of business today is a vote on the draft minutes for the November 9th, 2021 board meeting, which board members have received. Does a board member move for a vote to approve the November 9th, 2021 meeting minutes? I see Dr. Safier raising his hand. Do we have a second? Thank you. Mr. Franco. Does any board member have comments or edits on the minutes? Seeing none, I will call for a vote to approve the November 9th, 2021 minutes. All in favor? Thank you. The board minutes are approved. We have several announcements this morning. First, our chair, Jennifer Jones Austin, has left the board effective December 31st, 2021, after her term expired. Jennifer provided invaluable leadership through extremely challenging times, during which the board and the jails navigated the ongoing COVID crisis, and the board passed groundbreaking restrictive housing rules. We are extremely grateful to Jennifer for her service to the board and the city, and for her commitment to improving conditions for persons in custody. We expect that Mayor Adams will appoint a new chair for the board, but that has not yet occurred. In the absence of a permanent chair or vice chair, and barring any objections, I have agreed to chair this meeting. Second, James Perino's term expired last year, and he has left the board as of December 31st, 2021. I want to thank James for his service to the board. He cares deeply about everyone in the jails and brought a critical operational perspective to his work on the board. We are grateful to him for his service to the board, the department, and the city. This morning, we are also very pleased to welcome Amanda Masters as Interim Executive Director of the Board of Correction. Many of you know Amanda because she has deep roots here at the agency, where she served as Deputy Executive Director and then as Acting Executive Director. Since that time, she has worked for Public Advocate Letitia James and most recently at the Law Department. We are thrilled and deeply grateful that Amanda has agreed to serve again as Interim Executive Director while the board completes its search for an Executive Director. We are also very pleased to announce a new board member, Freya Richterink. For the last 2 years, Freya has worked for the first Deputy Mayor, where she focused on public safety, criminal justice, and the city's pandemic response. Prior to that, Freya has significant public service experience, including working on the plan to close Rikers, co-founding a startup focused on expanding educational opportunities for incarcerated people, and working at the New York City Council. Welcome, Freya. Last, but certainly not least, this morning, we welcome the city's new Department of Correction Commissioner, Louis Molina. Commissioner Molina hails from the Bronx and has a long and distinguished career in law enforcement, including the New York City Police Department and correctional settings, where he served at the department as an assistant commissioner and chief internal monitor in connection with the Nunez litigation. Most recently, he served as chief of the City of Las Vegas Department of Public Safety with responsibility for the jail system. In a few moments, we will give Commissioner Molina an opportunity to address the meeting. On behalf of the board and staff, we welcome you, Commissioner, and look forward to working closely with you and your team to further the goals we all seek: a safer, fairer, and more humane jail system in New York City. Today, Correctional Health Services will present requests for 2 variances from the minimum standards, having to do with tuberculosis tests and psychotropic medication. We will also hear presentations from the department on the state of the jails and their plans to implement the board's new restrictive housing rules, ending solitary confinement. The department and Correctional Health Services will also provide an update on COVID-19, and the department will present on the Nunez Monitor's most recent report. On a solemn note, I want to remind people that since our November meeting, 2 people have died in custody. A 28-year-old man died at Bellevue Hospital Prison Ward on December 10th, 2021, and a 55-year-old man died at Rikers Island on December 14th, 2021. We send our heartfelt condolences to their families and friends. The Board of Correction has begun investigating these deaths. Before proceeding with the agenda, I understand that we have been joined by New York City's Controller, Brad Lander, who has requested an opportunity to speak. At this time, I would like to call on Controller Lander, and thank you very much for attending our meeting this morning.
All right, can you see me? Can you hear me okay? Thank you so much. Good morning to the Board of Corrections members. Thank you, Chair Sherman and Executive Director Masters, for the opportunity to speak before you this morning. I want to thank you both for stepping up during this time of crisis to provide leadership. Thank you for doing that. And I want to welcome Commissioner Molina and your team as well. I'm joining you in my second week as New York City Controller out of a deep sense of urgency for the crisis on Rikers Island, posing a terrible threat to the safety and well-being, both of those being detained there and those working there. I hope to establish a strong working relationship with the board and the department to help our city address this crisis.
Thank you.
I first want to acknowledge the board for the work you've done over the past 2 years under the most challenging circumstances. I know you've had to be creative to conduct the mandated oversight in a pandemic with limited resources and capacity and during transition. While I don't fully agree with the view that the RMAS system you adopted would have marked an end to solitary confinement, I do want to give you credit for engaging in a thoughtful rulemaking process and express my disappointment that the emergency declaration pauses it from moving forward. As we get started, I know many of the individuals who come to testify before you month after month, and I just want to take a moment to recognize them and thank them for their role as well in working with you, in particular the survivors of solitary confinement, as well as family members of those who lost their lives in custody. And like you did, Chair, in addition to the 2 deaths since the board has met, I just think it's important to pause and acknowledge the 16 deaths in custody in 2021, the highest number in 5 years. I take my role as New York City's Chief Accountability Officer very seriously, and I'm really committed to working in partnership with the board and the department to ensure that our jails comply with minimum standards of care, that we address the threat of COVID, that we confront the staffing assignment crisis, and that we advance policies to further reduce the jail population and finally shutter the jails on Rikers Island. As the citywide elected official tasked with oversight of the city's finances, I come mindful this morning that New York City spends exponentially more per capita on incarcerating our residents than any other city in the United States. The most recent analysis from the Controller's Office found that the annual cost of incarceration rose to an all-time high in fiscal year 2021, despite a 15% decline in the average daily population. We currently spend the equivalent of $556,539, more than $500,000 per person per year to detain them in our system. And yet the rates of violence and use of force, both against detainees and against staff, are at an all-time high and continue to climb. We can and we must spend our shared public resources more wisely to achieve safety and justice. And I just want to say, not necessarily an all-time high relative to population, but at a just atrocious level. Clearly, a part of that is a broken staff assignment system that was highlighted so clearly in the recent New York Times article. When I visited Rikers in the fall, I talked to detainees who couldn't go to their doctor's appointment because there was no staff to accompany them. I saw units where there was regularly no staff on the floor. I even spoke to young men in one unit who said, "We're glad to clean the place up ourselves, but we can't even get the supplies to do it." The staffing assignment crisis is real. The Department of Corrections has long been on the controller's watch list, and we're going to keep a close eye on staffing patterns in the coming months until this crisis is addressed. At the same time, to achieve the urgent goal of closing Rikers, we must continue to pursue decarceral policies that move away from locking people up for low-level offenses, reducing the amount of time it takes to process cases so we can reduce the number of people held awaiting trial, and ultimately close the ongoing humanitarian crisis that is Rikers Island. I'm grateful for the chance to join you today. I look forward to a productive dialogue in the coming weeks and months, both with the board members and Commissioner. I look forward to meeting with you and your team and working with you as well. We do appreciate and recognize the challenges facing the men and women of the department and the work that they do, and we thank you for leading at this critical time. I look forward to a productive dialogue with all of you in the coming weeks and months about how we can best achieve the safety and dignity of both the staff and the people in custody in New York City. Thank you.
Thank you very much, Mr. Controller. We look forward to working in partnership with you on our shared goals.
Thank you very much, Acting Chair, and thank you again both to you and Amanda for stepping up to serve at this time.
Thank you. On November 1st, 2021, Mayor de Blasio issued an emergency executive order suspending the board's minimum standards governing the risk management accountability system, which ends solitary confinement. At our last public meeting, the board approved a resolution condemning this action. Since January 1st, Mayor Adams has continued the practice of using emergency executive orders to suspend the minimum standards, and we remain deeply concerned. We remain concerned about the delay in implementation of these important policy reforms and look forward to hearing the department's plans for implementation. The use of executive orders to suspend the board's minimum standards remains a fundamental threat to the board's authority as an oversight agency. We call on the new administration to work with the board and the department to proceed with the implementation of the board's minimum standards, which provide baseline protections for people in custody. And now I'd like to welcome Commissioner Molina. Commissioner, it's a pleasure to see you today. Good morning. And please feel free to address the board at this time.
Well, good morning to all of you. Thank you, Chair Sherman, for this opportunity to address the board. And thank you to all the board members for your service and dedication. Today marks the 11th day of my tenure. It also marks a new beginning of a constructive partnership between the department and the board. I want to first take a moment to introduce myself to you and the public. I've had the unique experience of having worked in all three major pillars of our criminal justice system. I've worked in policing, I've worked in a prosecution office, and corrections. Most recently, I served as the chief of the City of Las Vegas Department of Public Safety. Prior to that, I was the first deputy commissioner at the Westchester County Department of Correction, which upon when my tenure started there was also under federal oversight, similar to us here in New York City. And myself and the team there successfully really transformed that system in Westchester County. And the U.S. Attorney's Office in the Southern District acknowledged our work there as transformative. I worked at the Brooklyn District Attorney's Office, and I was a member, as you said, of the New York City Police Department. I'm no stranger to New York City, and I'm no stranger to the Department of Corrections. As you stated earlier, I was the former Chief Internal Monitor and Acting Assistant Commissioner of the Nunez Compliance Unit. I've wanted this job for a long time, despite knowing the many challenges the department faces, but I'm committed to reforming this work. So just to be clear about a few things, I strongly believe in criminal justice reform. I strongly believe in transparency. I strongly believe in working with the board as well as the advocate community and public defenders to make our jails better and safer and more humane. During my time in Westchester, that approach served me well, and I fully intend to continue with it here. In fact, one of the first meetings I took, even before my first day in office, was with the attorney in charge of the Legal Aid Society, and I'm in the process of arranging quarterly meetings with all of the public defender offices across the city. Those relationships are important to me because I know that we share an important goal to maintain a safe and humane jails for the people in our care. Similarly, the Board of Corrections has been an integral part of holding the department to a higher standard. And I hope to show you over the coming months that I value your input and your oversight. The need for reform in our city's jails has never been more urgent than it is now. The COVID-19 pandemic has created challenges that no one could have foreseen. I came to the department right after the Omicron surge hit New York, forcing us to open COVID-confirmed housing areas in every jail and shut down many of the external program services that the people in our custody need and deserve. And the morale of our staff is at an all-time low. Over the past 11 days, I have toured the facilities, spoken with officers, civilian staff, union leadership, and the people in custody to assess the situation and work with the various stakeholders on ways to implement changes that mutually benefit officers, our civilian staff, and the people in custody. The first thing we need to do is establish a foundation of safety and security for the benefit of everyone in our facilities. We can then build upon that foundation in order to expand our programs and services to ultimately restore the department to a rehabilitative correctional system we can truly be proud of. I want to be brief and get to your questions, but I want to take a few moments to address a couple of issues that I know you have questions about. The first, the implementation of the Risk Management Accountability System, also known as RMAS. Let me begin by expressing my view of restrictive housing generally. The fact is that there are people who commit acts of violence at Rikers Island, and we need a way to separate those individuals in order to keep people safe. But that method must be effective, it must be humane, and it must be fair. Those are the principles that I see in the RMAS rules, and those are the principles I am committed to. I'm aware that the board and the people in our custody have been waiting since November 1st for the new system to be implemented. And I can assure you that getting an implementation timeline in place is one of my top priorities. I have already started taking a hard look at our RMAS plans to see if there are ways to make them more efficient, more effective, and more in keeping with the spirit of the rules. I want to make sure that we explore all of our options. I have my team working very hard to resolve the questions and concerns that I have and to find the right pathway forward. I will certainly update the board as soon as we have a clear picture of when we can get RMAS in place. Second, as you know, the mayor issued an executive order on Sunday regarding the de-escalation unit rules that was scheduled to take effect yesterday. Until quite recently, we were hopeful that we were on track for the January 10th deadline. Unfortunately, due to the Omicron surge and our staffing challenges, we realized that would not be possible. because of the dramatic increases in positivity rates in the jails, we are not able to vacate the de-escalation units at this time. It is undeniable that Omicron is an emergency and that the current conditions meet the legal standard for an emergency order. We did not want to be out of compliance even for one day, and we felt that getting an executive order was the fastest way to prevent that, while allowing us the flexibility that we need to manage the situation that is likely to evolve over the coming weeks. In the interest of full transparency, as soon as we knew this, that an emergency order would be forthcoming, the DOC team did reach out to the board's acting executive director to explain the situation. I am fully aware of the tensions that arose in the fall related to the use of executive orders with respect to the Board of Correction rules, and I can assure you that this is not the way I wanted to start our relationship. I believe that full compliance is the best approach, and seeking variance is the far better approach whenever possible because of the flexibility that we need in order to deal with the Omicron emergency, and in part because of the deadline was yesterday. We decided getting an executive order was the best approach. Moving forward, this is our plan. We will phase in de-escalation units in each facility as soon as we're able to move people into other housing areas, and we will continue to update the board throughout the process. As I said, we were very close to meeting the January 10th deadline, and to the extent that this COVID surge permits, we will work as quickly as possible to get into compliance. I look forward to answering your questions. My team looks forward to answering your questions on these subjects and any others that you have. Thank you for allowing me a time to just introduce myself to the board and the public.
Thank you very much, Commissioner, and I'm sure my colleagues have questions, and I'll turn it over to them in a moment. I did just want to remark and react to what I believe I heard in your comments, which gave me some comfort that the board and the Department of Correction will be working together moving forward to address the crisis in the jails. And I did hear you reference variances, and do look forward to the extent that the department, as your plans come into focus in the coming days and weeks, to the extent that the department requires flexibility beyond the rules. I do look forward to working with you and your team and the rest of the board on, if necessary, putting appropriate variances in place that will eliminate the need for emergency executive orders. With that, do my colleagues have questions for the commissioner?
I have some questions. I have three questions. Could you please discuss the reasons why you fired Serena Townsend? Could you please discuss for this Bobby Cohn? Could you please discuss as I see it, a important and disturbing contradiction between the department's claim that they are providing medical care services and the executive order declaration that because of inadequate staff, you cannot bring people to the clinics and that you cannot provide staff for the clinics. I'd like you to comment on that, but to me, I'll just tell you that suggests that you are not able to provide access to care for the persons that you are caring for on Rikers Island. And that creates a situation where the jails are dysfunctional, and I think perhaps constitutionally problematic. And the third question is, it's really a plea. The department is not providing televisits for people who are in COVID housing. That's close to 40% of the population last week. And people who don't have or not in COVID housing have access to televisits. The tablet system that you have from American Prison Data Systems is able to provide televisit communications, and the board has been talking with the department for several months on this issue. But just yesterday, we received a communication from the department saying that you have no plans to use that system to provide televisits for COVID affected people. Period. I would hope that you can resolve that question and answer the other two. Thank you, and welcome.
Thank you for your question. I'll answer part of your question, and I'll turn it over to Chief Stoops to talk about our staffing issue regarding escorts. But first, as it relates to former Deputy Commissioner Townsend, there are two distinct issues here. One is a personnel matter, and the second is the question of our disciplinary system. As to the personnel issue, I don't think it's appropriate for me to discuss that in a public forum such as this. As for our disciplinary system, this is an important question. Accountability through fair and appropriate discipline is essential in this department. Improving staff morale is also essential. Both are going to need a lot of work if we're going to turn this department around. I plan to strike the right balance between holding staff accountable and treating our staff fairly and respectfully. I look forward to continuing to update the board on our plans as they take shape. Chief, can you talk about the staffing escorts?
Yes, good morning, everyone. As it pertains to medical services, once we put our strategy into place with regards to ensuring that person receives medical services, that is one of the areas of focus on a daily basis that we as an agency have discussing with CHS.
We're having some trouble hearing you. I think maybe you need to be a little closer to the microphone, maybe?
Can you start from the beginning, please, Chief Stoops?
Yes, good morning, everyone. As it pertains to medical services within the agency, medical services is one of our areas of focus that we collaborate with medical services daily to ensure that we have adequate staffing to support the clinics, to ensure that persons are receiving medical care, whether it's scheduled appointments or escort to outside medical services. As a part of our daily redeployments, where we have headquarters staff reports to my office, and that each facility report to us the need for a staff member to support the clinic or an escort to some type of service, we redeploy those administrative staff to those areas. Sometimes it is our reality that it may take longer than we would like to get a staff member to support the request, but the clinics is a focal point of the agency to ensure that person in custody are receiving timely services. We have a dedicated team from our Central Intelligence Bureau. Whenever there are persons who are reserved to go out to an outside hospital for any type of medical services, this team is dispatched to the facility who have made a notification to our EOC, which is our Emergency Operations Center, which operates 24 hours a day, 7 days a week with a redeployment of staff, and send those staff members to support those facilities and their requests.
So you disagree with the department's the emergency executive order number 7, which says that whereas the Department of Corrections staffing shortages are affecting health operations, including the availability of escorts to bring patients to the clinic and of DOC personnel to staff the clinics. And that's one of the bases for your calling for declaring the emergency executive order, asking the mayor to declare that. Is the statement in the EEO number 7 true?
Austin, could you answer that, please?
Sure. Hi, this is Austin Rahman, General Counsel. Can you hear me?
Yes.
Okay. Good morning. The statement that you're referring to was first noted in September when the first version of that EEO was issued. That's the whereas clause. That's stating the basis for the emergency. And that's the basis for what then followed were various suspensions or modifications to the rules. At the time, there were concerns in the agency. Given the staffing shortages, will we have this type of challenge? And as a result, various reforms were put in place through the EEO. So that is not a statement saying we are currently unable to provide. Rather, that was a statement of emergency. And now the various changes have given us the capacity to use staff so that we can get people to our best ability to their medical appointments.
Well, I appreciate you saying that. I don't believe that that's what it says. The whereas describe the situation right now. The whereas saying that the first EEO was placed on September 2nd is a true statement. All the other things are the reasons why you're asking to continue the EEO, and I don't think you're claiming that any of them are wrong, except for you're claiming now that you can provide medical services. Our staff do not agree with that, and I don't think the CHS agrees with it. We'll find out. The reason I raised it is because it is a dangerous situation to bring people to the jails if you cannot provide access to health care, and it's one of the fundamental constitutional rights in this country to have access to health care if you're in jail or prison. Thank you.
Thank you, Dr. Cohn. I just would like to respectfully follow up on Dr. Cohn's question regarding the termination of Serena Townsend. And as I understand the Nunez consent decree, the consent decree does make the dismissal a matter of public accountability, which, as I understand, will be explained to the monitor and to the court as a matter of public record. Given that that's the case, is there more information that you can provide to the board regarding this?
So I understand your concerns, and I understand that the federal monitor may have concerns. I'm actually scheduled to speak to the monitor this afternoon about this issue, and I think it would only be fair for him and me to defer this question until I had a chance to discuss the decision with him directly.
Well, thank you, Commissioner. We will look forward directly as soon as possible after that to a further conversation regarding the action. Are there further questions for the Commissioner?
Good morning. I apologize in advance. I've lost my voice. But first, I wanted to say welcome to the Commissioner, and I look forward to working with you and your staff, having spent the last several years working with both the board and the department. Really looking forward to working in this new capacity with you at this very critical time for the jails. I wanted to just echo my colleagues' concerns about the dismissal regarding Serena Townsend, and understanding that there are some steps you need to work through, and that other forums may be appropriate for that. We do really look forward to better understanding what the bona fide reason was for the change. Regarding the visit issue that Dr. Cohen raised, I just did have a question about the numbers of the virtual visits that you're having. Wondering if it's possible to understand how many of those are happening per day or per week, just so we can understand the volume of the virtual visits and how it compared to back when in-person visits were happening, to ensure that those connections are continuing to be made with families and loved ones.
So we're getting you the number on the televisits for you, but while the staff's looking that up, I just want to say, we are also exploring and evaluating the technology that Dr. Cohen talked about with APDS and other technology providers. So as soon as we have the ability to sort of increase access to connectivity with those that are in our care and their family and loved ones, we're exploring that.
Thank you.
Hi, I'm Daniel Addis. I'm the Deputy Chief of Staff. Good morning, everybody. Between December 1st and December 28th, there were 2,039 televisits hosted by the department, and 1,839 video conferences were facilitated by the department between people in custody and their legal representatives.
Thank you. Would you also be able to share information regarding, you mentioned the challenges of staffing and morale. Would you be able to share current information regarding staff absences, sick numbers, AWOL numbers, and those areas?
I'd like to amplify that request for to the commissioner. I think the board, to understand what's going on in the jails and to understand why you're requesting the emergency executive orders, we should know, and the public should know, how many units are not being staffed each day. How many times when you just have an A officer in and you don't have any B officers, and how many people are in all the categories of not coming to work by category. And we should get that daily so we can understand, we can see the improvement that you hope to achieve, and question you if if you're not achieving it, what's the next step? Thank you.
Senior Deputy Commissioner Spinell is going to speak to the question that the board member asked. Commissioner.
Thank you. So in regards to sick, if you want to look at the overall numbers, we're averaging about 219 people going out sick a day, with the highest, last Friday was the highest at 368. And right now there's 2,317 people currently out sick. When you take that number with the people that are indefinite sick, it's about another 1,000 that are indefinite sick and don't come to work at all. And then we have another 809 in a medically restricted category that are not allowed to have prisoner interaction. So when you add all those numbers up, those are pretty significant numbers, and it's probably around almost 30% of our headcount. So that those numbers create staffing challenges. So we're looking ways, the commission is looking at ways to bring people back, especially evaluating the people that are medically monitored, and looking at people, what are the reasons why they're out more than 40 days, more than 60 days, and not in the indefinite sick category. So we're looking at a lot of things.
Thank you very much for that. Can you tell us of the 200 and or the number out sick per day, how many are going out due to COVID versus other reasons?
So basically, it's about 10 a day as a result of the either a second COVID shot, first COVID shot, or a booster shot. And then when you look at the numbers for in the past 10 days, I guess, for actual flu-like symptoms, we're averaging around 60 a day, with Monday on January 3rd being the highest, 125. So those are real time numbers that we're looking at.
And how many people are going absent without leave each day?
I don't have the absent without leave numbers unless somebody else have them, but we can have them.
Chief has it.
Yeah, hi, this is Chief Stoops. As of yesterday's data, as pertains to persons who were placed on leaves of absence without pay as a result of the vaccine mandate, there was 108 correction officers, there was 5 captains, and 1 ADW who are still currently out on leave of absence without pay.
Thank you. In terms of AWOL, absent without leave, so number who would be showing up with, not showing up without an excused absence, what are those daily numbers?
We'll get it to you, that number.
Thank you.
I have one more question. Could you please describe, I mean, you have, the commissioner has changed the policy which required correction officers who were reporting sick to be evaluated by city contracted physicians. This policy was put into place to decrease the number of people who just stayed out with the department's unlimited sick leave policy. You changed that. I don't know what the outcome of that will be. My guess would be that it would tell people that they can stay out sick without having to justify it. What is your plan for increasing the number of officers who come to work?
So while we still have a lot more work to do, today the department is in a much better place than it was during the staffing levels when that decision to implement that formal policy was made. At this point, I don't think those measures are necessary. I want to work with our staff and our unions to find other ways to keep bringing people back to work. To be clear, our officers who call out sick are still required to provide proof of illness to the department if that illness lasts more than 2 days. What really has only changed is really the timeline of that reporting.
Thank you. I think we look for, given the urgency of the circumstances and the staffing needs, I think we look forward to hearing from you as soon as possible with more detailed plans for how you're going to work with the union to bring staff back and to address the staffing needs. Do other members have questions for the commissioner and the team? Mr. Franco?
Welcome, Commissioner Molina. How are you? Could you talk a little bit about your perspective of what you intend to do regarding young adults at Rikers? Under Commissioner Torres and others, we have been working with advocates and philanthropy on a task force, and I would love to hear your perspective of how the work would continue.
Good morning, Mr. Franco, and thank you for that question. Some of you may know, I come from a programming background, so programming for our entire population is vital, but it's even more vital for our young adult population. Deputy Commissioner Torres, can you just talk about our young adult programming, please?
Good morning. Good morning, Board Member Franco. Happy New Year. It's a pleasure to speak to you. For those of you who don't know me, my name is Francis Torres. I'm the Deputy Commissioner for Programs and Community Partnerships. I appreciate your question, and as a matter of fact, something that we need to share with you is twofold. Number one, that upon coming in as our new commissioner, Commissioner Molina and I had an opportunity to meet and discuss the importance of the work that we have been doing with young adults, something that he had already seen during his tenure here back in 2016 and 2017. He was very familiar with the work we were doing with the adolescents as well as the young adults. And so one of the first things we did was just bring him up to speed with what we have been doing under FDC Stanley Richards. you are too familiar with that. That is the work that we've done with the Young Adult Task Force. He is fully aware of it, and as a matter of fact, immediately reached out to our co-chair to ensure that work continues, as we are committed to doing so. I have also provided him with a summary on the work that we have been doing at RNDC, especially as it relates to number one, adding additional program counselors to provide those services that are done inside the housing areas as group facilitation, as well as other emotional and evidence-based practices. We've also provided him with a summary of the recent work that we've been doing through our consulting team, which you are well versed because you've been a part of our Young Adult Task Force and you've had the opportunity. So our work relevant to young adults is not coming to a halt. We certainly will continue to evaluate what it is that we've been doing, how it is that we are moving forward, and how do we measure the impact of any of those new evidence-based programming, as well as best practices that were implemented June of last year to present. Thank you.
Thank you.
If there are no further questions from board members, we will move on. Again, welcome Commissioner Molina, and thank you for your presentation today, and we very much look forward to working with you in the days and weeks ahead.
Likewise, thank you.
So moving on, I am informed that Council Member Tiffany Caban has joined us, the Council Member from the 22nd Council District, and that the Council Member would like to address the board and the public. I see you now, Council Member, and good morning, and thank you for joining us.
Good morning. Thank you for having me. Just a preface, just in case my dogs may bark, I apologize in advance. As was mentioned, my name is Tiffany Caban. My pronouns are she, her, council member for the 22nd District, which includes Rikers Island. Thank you for allowing me to give some brief comments. And thank you, Commissioner Molina, for welcoming me and my colleagues for an unannounced visit on your third day on the job. You know, we visited last week. And it's a place that I've seen many times as a public defender when I represented the thousands of folks that have been caged there. And the conditions we observed during this latest visit were profoundly troubling. You know, I would say manufacturing an even more acute mental health crisis, or exacerbating an even more acute mental health crisis that already naturally exists among the population. I was also amongst the large cohort of folks who visited the island last September. When I was there, we weren't able to enter an MO unit this most recent visit, but when I was there, I spoke to someone who was so desperate to get access to mental health care because they had a diagnosis, they knew they needed it, couldn't get those calls answered, showed me fresh self-harm wounds that were clearly infected, and said, I'm doing this because the only way for me to get to see a mental health professional is to get on suicide watch. That's just one example of many of the conversations and observations I made while visiting the island. During this most recent visit, there were plenty of folks that consistently said they were not getting access to the health and mental health care that they needed and deserved. But also the issue that I want to focus on today is the restrictive ESH housing that is currently being run as a functional equivalent to solitary confinement, punitive segregation, synonyms, whichever word you want to use. Although according to the prevailing jargon, they were not technically in solitary confinement. I met people on ESH who said they had not seen another person or sunlight in several days, They were going maybe every 5 days in between showers. When I was there were 2 folks that had been locked in the showers for a very long period of time. There's no difference in the out of cell time and abysmally inadequate access to medical care. Someone I spoke to waited 2.5 weeks to have broken bones put in a cast. And there were other basic human necessities not being met. These conditions are torture, plain and simple. And I want to remind the Department of Corrections that a supermajority of this council opposes solitary confinement and agrees that we're never going to torture our way to safety. We know from all the data, evidence, studies, it's why our collective societal agreements around human rights demand that we condemn this practice. I want to take this opportunity to lift up 2 letters, one organized by the Releasing Aging People in Prison campaign, or RAP, and second by outgoing DOC Commissioner Vincent Schiraldi. Both clearly state that the conditions on Rikers compounded by this pandemic are lethal, and both implore us to stop sending people to Rikers. RAP even did the math and found that 5 times more people have died in prison of COVID, prison and jails, than have been granted clemency by Governor Hochul. And so we need meaningful pathways to release. And while I know that these are state bills, I want to express support for the state elder parole and fair, timely parole bills. And finally, I'd like to say in no uncertain terms that decarceration, premised on meaningful investments in public health infrastructure in our communities, and highlight the numbers and figures that our Comptroller Brad Lander had mentioned in his remarks earlier, that decarceration is the only viable path forward. And I look forward to working with all of you to accomplish this vital imperative. So thank you all.
Thank you, Council Member, for being here today and for your focus on this important work. And we look forward to working in partnership with you and with your colleagues in the Council towards our shared goals. Thank you very much.
If I could just respond, Madam Chair, just to say that, I'm a big believer in transparency. I too look forward to working with all the members of the City Council on many of these issues affecting our department. And as someone whose family has been impacted by incarceration, I can assure you that what I want is us to have a just and humane and dignified system of justice in this city and in this country.
Thank you, Commissioner. Again, thank you, Council Member, for being with us today.
Thank you for having me.
We're now going to move into consideration of the 2 variance requests from CHS. Amanda will provide some overview, and then CHS will present the variance requests. The public will have an opportunity to comment on those variance requests. After that, the board will discuss and vote on them. Amanda, would you please briefly introduce the variance requests?
Sure. CHS is requesting renewal of some very long-standing variances regarding psychotropic medication and TB screening. The board first granted the variance on psychotropic medication in November of 2005. Excuse me. The variance allows psychiatrists to see and evaluate stable adult patients on psychotropic medication, that being medications that affect mental function, behavior, and experience, in general population at least every 28 days rather than every 14 days. CHS says that this is consistent with the current community standard. CHS has provided updates in its June 2021 numbers of people who are receiving the psychotropic medication as of December 30th, 2021. The number of people prescribed psychotropic medication has decreased from 2,128 to 1,726. And of those people prescribed psychotropic medication, 868 are in general population with a prescription duration over 14 days, an increase from 738, and 450 of the people with psychotropic prescriptions are in MO or mental observation units. And by definition, they're on a 14-day schedule, a decrease from 492. 408 are in general population housing and on a 14-day schedule, an increase from 898. The board first granted the variance on TB testing in July of 2013. The variance allows CHS to use either interferon gamma release assays, IGRA, or TST for the TB screening, and to exempt from repeat screening those prisoners who have a documented negative test in the 6 months prior to their admission.
Thank you, Amanda. And I see we have CHS. I think we have CHS here. Good morning, CHS.
Morning.
Would you please present the variance request?
Sure. Good morning, Ross McDonald. Thank you, Amanda. I'll be brief since it was so well summarized, and these are quite long-standing. The first is the variance regarding psychotropic medications, which gives us flexibility to see our patients at a time interval that fits the assessment of our clinical staff in collaboration with our patients, and has been proved particularly important when we have struggles with access to patient care.
Thank you. Thank you. I am confirming, I do not believe that we have members of the public who have signed up. Oh, I corrected. There is a member of the public who has signed up to speak on the variance request. Natalie Fiorenza is the member of the public who has signed up to speak on the variance requests. Natalie Fiorenza, please raise your hand using the hand icon, which is below the participants list on the WebEx screen. You can also click on the silhouette of a person on the menu at the bottom of your screen. And once you open the participants list, you should see the hand icon in order to raise your hand. We will unmute you. I see you now, and you will be able to turn on your video and begin your public comment. You will have 3 minutes to speak. Good morning, Ms. Fearing.
Hi. Good morning. There was actually a mistake. I signed up to be speaking during the later public comment section.
Okay, we'll move you to there, and thank you for letting us know.
Of course, thanks.
Jackie, I have a question for Russ.
Yes, I think we can take the question now. We're going to move to the vote on the variance, and then we have done discussion, but I think it's fine to ask the question now.
Russ, the question I have is, and I understand it's difficult, and certainly in other situations you might not be seeing patients as much as some of us would want you to see them. So it's just a different world. But my question is, doesn't it make sense for somebody to see people at a more regular basis who are taking these medications, considering that we've lost a lot of people because, you know, of situations where basically for many years, people have taken their own lives. So the question is, are you totally comfortable by not using this moment to have more interaction? I guess that's what I'm saying.
Yeah, thanks for the question, Steve. I am, because I think, you know, in times like what we've been through for the last few years in the jail, really a tremendous safety net becomes our clinical prioritization. And I think this has given our staff a lot of flexibility to focus on the patients who need us the most. And that's a collaborative decision with the patient. So nobody would be reduced to a 28-day renewal schedule without collaboration and understanding of the patient. And often it's the patient preference as well. I think the other part of this variance to keep in mind is that when the rules were first written, there was a much more limited scope of psychotropic medications available. So primarily it was written with agents like lithium and Haldol in mind. And now we really have a range of medications which could, range to just medications to assist with sleep that would fall under this category. So I do think the key is that it gives us the flexibility to clinically prioritize rather than having our follow-up lists sort of clogged up with people who are on the list because the rule says we have to see them now, even when it feels inappropriate to the patient and the clinician, if that makes sense.
It makes sense. I understand it, but it's very important to me, and I think all of us, that we keep a very close look at this as we move forward, because of, you know, what has happened over the last couple of years in terms of people taking their own lives.
Yeah, and one other thing I would point out, Steve, is, you know, we've built that very important pathway with our health triage line for patients to reach out to us proactively, which really for the first time is a direct opportunity for patients to contact us from the housing areas, which I think has been a really important safety mechanism so that people can get a hold of us if something changes with their clinical situation in between scheduled encounters.
Thank you, Dr. Sapir. I think we are ready to move to a vote on the first variance request. Does a board member move to vote on the requested variance? Dr. Sapir.
Second.
Is there a second?
Second.
Dr. Cohn. So the floor is now open for questions, debate, conditions.
I have just a question of Ross as well. I understand the system that has been developed since the pandemic of allowing people to call the clinic directly during a set period of time. We've heard and we heard as of yesterday that system is not working very well. Can you describe? I mean, there was an absolute number of patients brought to the clinic, but I don't know how to judge that in terms of how many patients you wanted to have brought to the clinic, how many follow-ups you had scheduled, how many people requested sick call that day. But is the system working right now? And are the people who need 14 or 28-day reviews getting them?
So I think the system has been very helpful in this effort of prioritization that we've been dealing with. We all know that we have been in a time of crisis in the jails. And so access to patients has been limited. But I think that this is a critical safety mechanism that allows us to prioritize those patients. The data suggests that we do reach many of the people that call us for those complaints, and that we are able to prioritize them, and especially among the highest priority concerns, that we're able to reach those people in a timely manner. Others fall outside the windows, the time windows that we would hope. And I think that's where some of the feedback and the frustration might come from. But I think as a response to what the jails have been experiencing, it's been a critical safety mechanism.
Yeah, Bobby, it's Patsy. Good morning. And I just wanted to add to what Russ was saying. I think our health triage line, which we actually began before the pandemic, has been, was something that CHS wanted to do to supplement what is on the books and the minimum standards, and what the department had as sick call, giving patients direct access to us with their questions or their needs, rebalancing and prioritizing what DOC needed to focus on was absolutely invaluable during COVID, obviously during the early days, the first year and the second year, and then during the latter part of 2021, in terms of patients being able to call us and reach us directly with their complaints, their concerns, their questions, and our ability to resolve a lot of their issues and concerns and requests without having to have them produced to clinic, given what was going on in the jails. So I think it has been more than valuable, and its timing even before COVID was essential, and it continues now to this day to be really important. We're really taking care of the volume of calls has gone up or held steady, and we've been able to really resolve a lot of the issues remotely.
Patsy, thank you. I've always I believe that this program is a good one, and we'd always supported efforts for CHS to know who was requesting sick call. But can you describe now the successes and problems? I mean, we hear about problems and we don't hear about successes, but the problems that we're hearing about are very serious right now. Are they just isolated, or our staff were in the units yesterday and they saw calls not being able to get through for hours at a time?
That's not what our experience is, or the volume has held steady or gone up in cycles. We continue to respond to every call, whether they've gotten a live nurse directly between those hours that we operate, or when they've left messages, that we do respond back. I'm not aware of complaints or concerns that the triage line has not been working. We've also been able to, for people who we do need to see and do decide that we want to see, they certainly are requested to the department to produce to clinic, which falls into the larger question of production and access.
Thank you.
Do members have other questions? Hearing none, and there are no existing conditions to the variance. So given that it doesn't appear that anyone has proposed any conditions, I believe we're ready to move to a vote on the requested variance. Do I have a motion?
So move.
Thank you. With a second?
Second.
Okay, and we'll move to a roll call vote. Dr. Cohn,
Yes.
Dr. Sathier,
Yes.
Mr. Carrion,
Yes.
Ms. Rick-Turink,
Yes.
and I vote yes. So with five members present, 5 votes in the affirmative, the variance is approved. And thank you. And we'll move to the second variance vote. the variance regarding tuberculosis screening.
Right, so this is a variance requesting the use of the laboratory-based testing rather than tuberculin skin testing for TB screening, which has been very successful in our system, and happy to present the data that suggests that we've been able to maintain it through, the challenges of COVID and the last year. So thank you.
Thank you. Does a board member move to vote on the requested variance? Thank you, Dr. Safier and Dr. Cohn. The floor is now open for debate, questions, conditions.
I would just like to say I support this this resolution, this variance request. There are 3 methods to detect tuberculosis in jails that are in use: screening X-rays, gamma interferon, and PPDs. This gamma interferon is a very good method, and particularly during this period is the best method for doing it. So I urge the board to approve this motion variance.
Thank you, Dr. Cohn.
I just wanted to note there does appear to be one continuing condition regarding reporting on your initiatives that just want to make sure the board is aware of that condition.
Thank you, Amanda. And if the condition has been part of the variance in the past, I don't believe we have to, I believe we can vote on the variance with the existing condition, but correct me if I'm mistaken on that. And if there are no questions or comments or other conditions, I believe we can move to a vote on the variance. Does a board member move for a vote on the requested variance with the continuing condition that has been approved? Dr. Safier.
Second.
Dr. Cohn. And call roll. Dr. Safier. I see you giving a thumbs up. Yes.
Yes, yes.
Dr. Cohn.
Yes.
Mr. Carrion.
Yes.
Ms. Richterink.
Yes.
And I vote yes as well. And by unanimous vote, the variance is approved. That concludes the variance votes for today's meeting. We will move into the item on the agenda regarding the state of the jails, and I will turn to Amanda for an introduction.
The board remains deeply concerned about the staffing crisis that is leading to troubling conditions across the jails, including the provision of medical and mental health care, creating unsafe conditions and interrupting access to mandated and other services. For the department's update today, as listed on the agenda, we'd like to focus on 3 areas: decarceration, the transfer of women to Bedford Hills, and the impact on minimum standards. We will now ask the department to provide an overview, although I understand that you're actually, and correct me if I'm wrong, you're actually here today to answer questions and answers, but you do not have an overview, is that correct?
That's correct.
So after decreasing since a height recently of over 6,000, the jail population appears to have plateaued around 5,200. Are there additional steps that the city is taking to work with stakeholders to continue this decarceration?
So one of the things we're trying to focus on is improving court production. Obviously, Omicron has presented some difficulties in that regard, but we know that we are dependent on the court system to move cases along, and we're working with our partners to ensure that that happens. And
I'm sorry, I'm having a little bit of trouble hearing you.
So one of the areas we've been focusing on is court production, and obviously Omicron has presented challenges in that regard. We're working with our partners at OCA and internally to make sure that we are bringing people to court to the best of our ability. And again, obviously, we can't be bringing people who are at any risk of exposure to court and risk the continued transmission of Omicron. So we're hopeful and optimistic that the spike, as quickly as it came, will turn around and that we'll be able to resume those operations. And we're working on several technological solutions in order to ensure that the court system can move people through the system as quickly as possible, because our long stairs is a primary focus. As you know, Less is More Act was also very helpful in reducing our population. I can give you some numbers. Immediately after the Less is More Act was signed, 185 individuals were released, an additional 141 individuals were released as of December 28th for a total of 326. We will, if you have specific questions about Bedford Hills, we can discuss that separately. But we are looking at other options in terms of working with other stakeholders and district attorneys to identify individuals who we feel don't need to be here and don't need to be here for nearly as long as they are right now. And with a new district attorney coming in Manhattan and other district attorneys who are committed to ensuring a fair criminal justice system, we want to work together with them to make sure that we are limiting the people in our custody who absolutely need to be here.
Could you amplify that answer a bit and tell us more about communications that you've had or discussions you've had with the district attorneys other than the Manhattan District Attorney?
Well, we've opened some lines of communication with them beginning at the end of the last administration. And obviously, we're only 11 days into this administration, and we're working on new policies and programs and areas in which we can assist them. We don't make all the decisions about who comes into our custody and when they leave our custody. But the best we can do is care for them while they're here. But we are looking to add our voice into that conversation. And so I've been speaking with Commissioner Molina about how we can do that. And we are looking to continue those conversations and have either monthly or quarterly meetings with senior members of all the district attorney's offices. And those conversations are going to be ongoing.
Thank you.
I have two.
Does any board member want to continue on that topic before we move to the next one?
Yes, I have two questions. One is how many persons have been released from the 6-day program since August 21st, and the other is that given the mayor's position and the deputy mayor for criminal just whatever his name is, the justice, the new appointee, Phil Banks, speaking out against raise the age, speaking out against the bail system and calling for higher bails. How is the department going to decarcerate given that policy, that central policy of the administration?
We haven't had specific conversations with the incoming deputy mayor for public safety, and so we'll have to defer an answer on that question until we've had some more time to discuss with the administration. But again, we don't control bail, and so all we can do is see who comes into our custody. We can express concerns or identify individuals or categories of individuals who we feel don't need to be here. For example, people who we see frequently coming in and leaving within the 7-day period. To us, those individuals don't necessarily need to come here in the first place and significantly impact our operations because we devote quite a bit of resources to our new admissions process. But again, this is not something that is directly within the department's control, but we are interested participants in that conversation because it does directly impact our operations. As to 6A releases, I don't have a number specifically in relation to the date that you listed, but I can tell you that 6 individuals were released in the middle of the fall, and an additional 4 individuals were released under 6A just before the end of the prior administration.
Thank you.
The next topic.
Oh,
I'm sorry. Did you have a question?
Yeah, if I could ask about population.
Sure.
So you had mentioned the long stayers in custody. Do you have a breakdown of currently how many people in your custody have been there for those long periods of time? So 1 to 2 years, 2 to 3 years, and over 3 years, and generally how much of the population that makes up right now. And then, so that's just information that would be helpful. And then on a related note, can you describe what your process is for working with the DAs, working with the courts to specifically drill down on that group of people, who really represent a much larger share of the population than they did prior to the pandemic, and are really contributing to the growth in the population that we've seen?
We'll have to get you the specific information on our long stayers. I just want to make sure I'm taking it down correctly. You asked for a breakdown from 1 to 2 years, 2 to 3 years, and over 3 years. We can certainly get you that information shortly after the meeting. With respect to what we're going to do going forward with the district attorneys, again, it is the 11th day of this administration. I just want to iterate that is a focus of ours, is working with them to address those long stayers, and it's a huge priority for me, and I know for the commissioner. So give us a little bit of time, and we will certainly update you on what our plans are and how we can be involved in that process.
And if I could just add to that, prior to my appointment, I did have a meeting with MOPJ and talk through some strategies that they had. So I also look forward to working strategically with MOPJ, Deanna Logan and her team.
Excellent. Thank you. And then just a couple of other questions on population. Another request for data, and if you have to follow up, that's okay. How many people are currently awaiting transfer to state custody? So what share of the population does that make up? And generally speaking, how long is that taking? And is there anything that can be done to expedite those transfers so that doesn't represent a larger growing share of the population?
We can follow up with you on the numbers again shortly after the meeting, and we're taking a close look at the state transfer process. And again, obviously, Omicron is going to have some impact there, and we're working as quickly as possible because we do share your concern about the number of people that are in our custody, and the sooner we can get them out, the better it's going to be for us.
Okay, thank you. And then one final question on population. I wanted to follow up on what was raised regarding 6A, the city sentenced population. And just to understand, do you have, and if so, what is it, a process in place for evaluating people who are serving city sentences for early release? So, understanding those are case-by-case determinations. How do you go through that process? Do you have certain criteria that you look at to consider, which would inform those decisions?
We are working on a process. As you know, city sentenced individuals constitute a relatively small percentage of our overall population. So, 6A is important. It's something that we're going to continue to explore in the new administration, but it shouldn't be the focus of our overall decarceration efforts, just based on the relatively low number. But we are certainly going to establish a process, and and review anybody who we believe is eligible and appropriate for 6A work release.
Thank you.
So moving on to the Bedford Hills topic, unless there are any other questions. Just a brief history of what's happened so far. On October 21st, the department began moving women to Bedford Hills. DOC provided some details on this move to several of the board members on November 3rd and also at the November 9th board meeting. The board would appreciate a public update on the move and in particular steps the department is taking to ensure access to the courts, visits for families and attorneys, and access to programming. We also understand that the new transfers were halted for several weeks due to COVID outbreaks. And we ask that the department provide an update on the extent of the outbreaks and the impact that they had on the transferees from Rikers.
Then Dan can follow up.
Yes, good morning. As it pertains to our efforts of transferring our female
I
population.
apologize. I'm having a really hard time hearing you guys. I don't know if it's a mask issue or a microphone issue.
So, good morning. Can you hear me better? That's better? Okay, great. Thank you. I'll start over. As it pertains to our transferring of our female population to Bedford Hills, the latest data reflects that we have transferred 118 persons to Bedford Hills. As of our latest data, there remains 91 women at Bedford Hills. There were 25 that were discharged from custody and 2 returned to Rikers. There were also a population that the LGBTQ community that wished to remain on Rikers. Those persons were allowed that request. And we had 13 persons who were not transferred to Bedford as a result of collateral consequences. As of today, as you have stated, all transfers to Bedford Hills has been suspended, partially due to COVID. If there's any further questions, myself and my other team members will be happy to answer.
I'm sorry, you described a group of 13 people, but at one point in your description, but I couldn't quite hear what you were saying about the 13 people.
Oh, there were 13 members of the LGBTQ community that requested to remain on Rikers at Rosum Singer, which that request was granted.
Thank you. Do any board members have any follow-up questions about Bedford Hills?
I do. First, I just want to make sure that I understand. I think you said that 2 of the women who were discharged, or maybe I'm mistaken about that. I think you did say that 2 women were returned to Rikers who had been transferred to Bedford Hills. I was curious about the reasons for that return. I also wanted to understand the current state of visitation at Bedford Hills, if in-person visits are occurring or if they've been suspended, what access to virtual visits do women at Bedford Hills currently have?
Yes, to answer the second part of the question, visits at Bedford Hills have been suspended due to COVID. So there are no in-person visits taking place there for the entire population. As it pertains to the 2 persons that returned to Rikers, one was at the request of the LGBTQ community requested to return to Rikers, which was granted. And I will have to circle back on the definitive reason as to why the second person was returned.
Just to clarify, the individuals who are allowed some measure of choice are from the transgender community, TGNBI community, and it relates to their feeling of safety in certain environments. That was the basis for the policy, and so again, the basis for the transfer is related to where the individual feels most comfortable in expressing their gender identity and where they feel most safe. And so we took actions accordingly.
And with in-person visits suspended, what access do women have to virtual visitation?
So our children.
Can't hear you.
Bedford Hills does have some capacity for video visitation.
Okay, if specific information about the extent of the capacity and how often and how many visits, virtual visits are taking place, I would like to have additional information provided after the meeting as soon as possible to understand how women who have been moved from Rikers to Bedford Hills are able to visit with their families and loved ones.
Yeah, we clarified that.
Yep, we can get that to you.
Are there any other questions on that topic? No. So the third topic about our minimum standards, in the board's tours and in the complaints that we receive from people who are in custody, we continue to see consistent complaints on the lack of basic services. So we would like the department to address the steps that they are taking to ensure people in custody have access to basic services like recreation, and particularly outdoor recreation, access to fresh air and exercise, law library, barbershop, and congregate religious services or other religious access, and how these have been impacted by the recent spike in COVID-19 infections. Some specific concerns include whether there is adequate staff to ensure that the housing areas are safely cleaned, whether barbershop is available to all persons in custody prior to court appearances, whether recreation is consistently offered across the jails, and whether and when any outside providers will be allowed back inside the jails. Another major concern is that staff hear from persons in asymptomatic COVID exposed and confirmed COVID housing that they are and that they have been and that they will miss court dates, which may have significant negative impacts on their legal and their mental health status. Could please address these issues as well?
Thank you for the question. I'm going to let the programs team respond to that.
Good morning, everybody. Good morning. Programming is a key piece of the Commissioner Molina's vision about engaging people while they're incarcerated and creating safe environments, and we're committed to that. While we face the staffing shortages, we still have DOC staff going into the units, providing on-unit programming. We are on pause with our community providers, reevaluating that in the next week or so to see whether we can bring them back. We want to continue to provide services. We've engaged an external barber to provide haircuts and barbering services to everyone who is incarcerated. We have a call number for religious services. We are providing religious services in unit where we have clergy going to the various units. On each of our tablets, we have Bible apps and we have other religious apps that people can access religious services. And so we're committed to making sure that we're meeting minimum standards and in fact exceeding minimum standards during this time of increased COVID exposure. That's a large part of Commissioner Molina's vision around safety, understanding that programs provide people meaningful engagement, and that plan will continue to move forward. While we have challenges, we are continuing to provide services.
Are there any questions from the board members to follow up on that?
I'd like to follow up on that, on your comments, and thanks, Stanley, for your initial response. But the department is, as of 2 days ago, asked for an emergency executive order saying that you're unable to provide recreation, meals, religious services, visitation. So could you tell me how you measure those inadequacies and how you're going to figure out when you're going to change the executive order or end the executive order based upon some data that you're collecting, which demonstrates your ability to provide basic services? It can't go on forever, or maybe we will, it shouldn't go on forever. Assuming that the pandemic eases, well, when are you going to say that you don't need an emergency order quantitatively?
So, hi, General Counsel Asif Rahman. The two emergency orders that relate to the Department of Correction concern the staffing challenges that the department faces, as well as the COVID pandemic. And the emergency order concerning the COVID pandemic is not limited to the Department of Correction, but also involves other agencies and other citywide services for the residents of New York. I think everyone wants this pandemic to end. As to your question of how long the emergency orders will be in place, the emergency executive orders are intended to be temporary, not permanent, although they have been in place for some time. And some of the response to your question is driven by how long we have to endure this pandemic. And in hopes last year that things were starting to be resolved, we were hit with the Omicron pandemic. So part of the response is we don't know, because we are all still trying to manage through the pandemic. The other emergency executive order is driven by our staffing challenges. As we've reported publicly and to the board, the agency has taken a variety of steps, employed a variety of strategies to address our staffing shortages. And with the new commissioner's plan, we will be revisiting those and looking for other strategies to help address and tackle our staffing challenges. When those are tackled, we will be in a better position to lift these emergency executive orders so that we do not have to suspend these rules.
I would add too, Bobby, that the executive order, the department is not sitting back, not engaging people and providing minimum services. The chief, the deputy, the assistant chief both have made a commitment to provide recreation to people incarcerated, to ensure commissary is happening, to ensure basic services are happening. We all understand that when basic services happen in the facilities, we can create safer facilities for everyone. And that's what we want to do. Our programming staff, while our providers haven't been coming in, programming staff have been coming in every single day, engaging people. Our clergy have been coming in every single day, engaging people. We understand that minimum standards is a core part of operating the facilities in a safe and efficient manner. And Commissioner Molina is committed to ensuring those things continue, even with an executive order.
Yeah, thank you, Stanley. I don't know, based upon what you told us, whether or not you are providing these things. But my question is, when will your evaluation of medical care, mental health care, recreation, quantitatively dictates that you will no longer be asking for an emergency order based upon that inability to provide services. When will you? It's not a question of officer shortage. You don't have a shortage of officers. You have a shortage of officers showing up. But how will you decide when there's no longer a crisis? We're very interested in, we don't think you were appropriate to call for emergency executive orders. You never asked us a word about it. But you're saying, and you've done it, this is, that you've been doing it twice a week, whatever you require since September. Or I guess November. What kind of recreational activity will say it is not an emergency? What kind of commissary access will say there is no problem? How do you judge what's adequate and what's not? And those are questions about how we can get, when the city is going to lift these orders.
So thank you for your questions and your comments. Like I said in my opening statement, it is not optimal for us to operate under executive orders. We are going to begin a process to not only inform our future using the data that we have within the department and become a more data-informed ecosystem here as we make our decision-making. And I look forward to sharing those plans with you and the rest of the board members. It's only been day 11. So I get it. I completely understand it. I'm big on transparency and working within the compliance rules set out by this board.
Thank you, Commissioner.
I had one follow-up question to my original question, but only if there aren't any other questions from board members.
I just had something brief. First, just want to reiterate the request for data on who is getting those services, recreation, commissary, et cetera, so that we can understand, even with the emergency executive orders in place, to what extent services are happening. And then clearly, as you've talked about, the issue of minimum standards and critical services is directly linked to staffing. I know we requested at the top of the meeting information about unstaffed posts and AWOL officers not reporting to work without any excuse. And just in addition to, when you provide that data, wanted to just also request that provide information about, as part of your strategy for addressing staffing issues, what types of consequences are officers seeing if they don't show up. So information about the accountability mechanisms that the department has put in place, people suspended for those types of things, et cetera.
Thank you. We'll be responding.
Thank you.
So going back to the original question, I just wanted to sort of amplify that we were really looking for specific or concrete steps that you might be taking or contemplating taking. So for instance, if, given all of the unstaffed posts that our staff and I have seen recently and the staffing crisis, are you considering anything innovative with regard to how you deploy your staff, or is there some process where you're thinking about how to get people to rec that might be different than what you used to use with full staff?
Yeah, thank you for your question, and I'll let the chief expand on this. But we have leveraged our emergency operations center to make sure that we have eyes on all of our different housing units to make sure that people are safe. So we've done that. Chief, do you want to expand on some other strategies that we've done to expand presence?
Yes. Good morning. As pertains to our Emergency Operations Center, since we opened it, it continues to operate 24 hours a day, 7 days a week. It is managed by my office and my chiefs and other commissioners, whereas we each day look at each facility, facilities which are struggling as it pertains to insufficient amount of staffing. And as a part of our redeployment strategy, we supply staff members to support those facilities. And our reality with regards to unstaffed posts, with the redeployment strategy, since the end of the year going through the holiday season, we have seen somewhat of an increase, but it is tightly managed. Each facility is scrutinized by executive leadership members in our efforts to promote safe and secure facilities.
A follow-up question. Do you think it's safe to admit people to keep people in a housing area where there's no B officer, where it's an unstaffed post?
What normally happens when there's an unstaffed post, those posts, for the most part, those posts may not have a staff member that's reported by the facility at the initial beginning of the tour. But what the process is, staff members who are redeployed from headquarters who report to my office as a part of the redeployment process, we send staff members to those facilities based on the request of the facility.
So you're saying at what time of day that there's some point where facilities, where every housing area is staffed?
So it depends on the time that the staff members get there and the availability. However, in each unit, there's a control post officer, and we may have where it requires 2 B officers, there may only be 1. We have the ability to allow that officer to do cross tours from side to side.
And you're providing 14 hours a day out of cell for people in those areas?
Yes, we do not result in any reduction of out of cell time as a part of our staffing.
Do you think it's safe to have an officer running back and forth from housing areas rather than being having one officer covering 2 housing areas, running back and forth, not having visual on half the time on half of the people?
The A post officer has the ability to look down the tier and make observations. However, we are committed to keeping people safe. At the time, the B officer who is making the cross towards the one side doesn't have a B officer. The A officer does have the ability to gain their attention to report to the alternate side for whatever request.
Okay.
I just have a follow-up question on the cross tours. If you do have an officer that is doing that, are those posts considered staffed or unstaffed for purposes of tracking the data?
It is based on the table of organization. If the table of organization requires that a officer be on each side of the housing area, then the side of the unit where there is not an officer assigned, that is memorialized as an unstaffed post.
Okay, so if they're covering 2 housing units, then one of those would be staffed and one would be unstaffed.
That is correct.
Are there any other follow-up questions on this section?
Are you tracking meals missed and recreation?
Thank you for that question. As FDC Stanley reported, we have a process in place, whereas we, as a part of our strategy and reducing hours time of persons in housing areas, we committed to providing recreation to each unit. And in the event there are any issues that a facility is experiencing major challenges where that just can't be done because of some safety and security reason, we have a process that our assistant bureau chief Presley, whose facility operations, must be notified. And as it pertains to meals, each day we ensure that all persons are in custody are provided with meals.
You have the staff to do that.
We have staff to do that. That is one of our core priorities.
But you don't have the staff to escort people to clinic.
Yes, Bobby.
Okay. Thanks.
Thank you. I believe we're going to move into the next section of our agenda, the update on restrictive housing rule implementation. Under the rules passed in June of 2021, the department was to end the use of solitary confinement and implement the RMAS system by November 1st, 2021. Rather than meeting that deadline, the mayor issued an emergency executive order delaying the end of solitary confinement in the jails. While we understand and have obviously discussed here today and on other occasions, that the department is grappling with many changes and challenges in the jails, ending solitary confinement is no less an urgent matter. At our November board meeting, we asked the department to provide a clear plan to permanently and quickly discontinue solitary confinement and implement the RMAS model. We received assurances that the RMAS model would be largely implemented by December 31st, 2021, with full implementation to occur in the first months of 2022. That has not occurred, which may be attributable to a new and serious spike in COVID infections and the transition in mayoral and departmental leadership. So today, we again seek to understand the reasons why each part of the rules cannot currently be met, hear a timetable for implementing each part, and a description of interim processes being undertaken to protect the rights and safety of people in custody, correction officers, and all others who are in the jails. I will now ask the department to provide that update.
Thank you, Madam Chair. I understand the board's concern that the department has passed the deadline that was imposed during the last administration, and we are working very hard to get an update regarding when RMAS will begin. Answering this question for people in custody and from my staff and for you is a top priority for me. In fact, I met with the DOC staff to discuss this issue even before I took office. I have some concerns about the planned location at NYC, and I want to explore whether we can do better. It's not just about meeting the letter of the rule, but really the spirit of the rule. This is my 11th day in office, and I just need a little more time. But again, this is a top priority for me and my team. I'm confident we will meet or surpass the board's goals for the humane treatment of the individuals we need to place in restrictive housing. As soon as we have a plan and a concrete timeline for implementing it, I will be reaching out to the board to set up a time to discuss it in detail.
Thank you, Commissioner. We certainly do anxiously anticipate that plan and look forward to seeing a plan, a documented plan, and meeting with you to discuss it. I am hopeful and anticipate that that can happen between now and our next board meeting.
We could commit to that.
Thank you. Dr. Safier, did you have a question?
No, I was just nodding my head. I think we have to give you some time, but I think the time you just laid out makes sense and the right thing to do. We really need to make this come together.
Thank you.
Thank you.
Are there any other questions from board members?
Bobby,
Dr.
we
Cohen?
can't hear you.
Yes, I have a question, couple of questions. How many people are in punitive segregation right now, and when does the department plan on removing them and closing down the PSEG units as required by the board rules? And when will DOC start allowing legal representation for people who have infractions, as the board rules now require? And also, are you if you're housing people in NIC single person cages or units that were intended for RMAS, are they having disciplinary hearings before you place them in those areas, or when they're in those areas, if it's a PhD issue? Those are my questions.
So thank you for that question, Bobby. As of about 5 a.m. since this morning, there are 8 persons in punitive segregation.
Great.
And Dr. Cohen, this is Stephen Kaiser. To the rest of your question, people are still provided due process, full due process for the previous minimum standards related to any infraction hearing and any subsequent placement in a restrictive housing setting. In terms of the transition away from punitive segregation and the implementation of legal representation, some of that is tied to the HALT Act, which is the state law that will come into effect in April of this year. But it's also tied to the plan that we and the commissioner just discussed, and that we plan to discuss with you, related to replacing our current restrictive housing system with a new system, with the RMAS system. And so some of that, the answers to those questions, I think will be answered through our conversations over the coming months.
So are you placing people in other restrictive housing areas without hearings now, with representation?
No, so our previous practices related to due process and placement in a restrictive housing setting have not changed. Individuals are still provided hearings and the due process associated with placement into any of our restrictive housing settings.
But without representation?
Correct. The department has not implemented the legal representation aspect of the rule at this time.
Why?
And there are certain staffing issues, and it's tied part and parcel with the look that we're taking at the RMAS plan that the commissioner just spoke about.
So you're using an executive order to deny representation to people who are being charged with infractions?
I don't think we want to do just minimal changes, right? We want to live to the spirit of the board rules as it relates to RMAS. So I think when we lay out our plan, I'm hoping that you'll be very pleased with it and impressed with what we're going to do to operationalize it.
Well, thank you, Commissioner, but I don't think this is a small part of the plan. It was a major issue with the city and with the law department and with the department, and it's a very important part of due process, and it does not require additional staff. So I do not understand. I would hope that you would, as soon as possible, implement that. You don't need our permission. You have our rule. So I really hope that this is that people get the representation that they are entitled to based upon the board rule.
Thank you. That's our intention.
If there are no other questions from board members, we will proceed to the next item on the agenda. And we will, as discussed, look forward to seeing the full plan for implementation of RMAS and the full rulemaking, and to discussing with you in between now and our next public meeting. Amanda, we're going to move on to COVID-19.
Thank you. And in this section, we have a slide deck to supplement the report on COVID-19, which there. Thank you. So as you know, the Omicron variant is sweeping through the city's jails, and the alarming surge, which began in mid-December, drove the department to reduce programming, suspend in-person visits, as well as congregate services. While essential, these changes come at a time of profound crisis. Oh, we should stay on the first one for now. Or the next one is the first one in my mind, but that's fine. Thanks. We've asked the department and CHS to provide an update on their latest efforts to reduce the spread of COVID-19. We believe that vaccination for all who are in the jails, people in custody, and staff is essential to mitigating the effects of the emergency, and reiterate our support for reducing that jail population as quickly as possible. Before hearing from the department and CHS, we will provide an overview of COVID cases in the jails, the jail population, and vaccinations. A longer presentation, complete with information on housing area capacity, will be posted on the board's website after this meeting. So on January 4th, CHS reported a total of 1,126 people in jail had or had recovered from COVID-19. 499 of these individuals had an active infection. As of January 5th, there have been 498 COVID cases among CHS staff and 2,567 COVID cases among DOC staff. New staff cases rose considerably in the past month. DOC reported 107 new staff cases in December, more than 3 times the number of new cases that were reported in November, when there were only 34 new staff cases. Meanwhile, CHS reported 101 new staff cases in December, a dramatic increase compared to November, when there was a single new staff case reported. Thanks. The first wave of the COVID-19 pandemic prompted coordinated efforts to rapidly reduce the jail population. By April 29, 2020, the jail population fell to a historic low of 3,832. This trend slowly reversed for much of the latter part of the pandemic, and the jail reached a new high last month, peaking at 6,095 on September 14th, 2021, a 59% increase compared to April 29th, 2020. The ongoing jail crisis and recent surge of COVID-19 led to additional calls for decarceration. The jail population fell sharply in September 2021 and then more gradually before eventually plateauing in December 2021. On January 3rd, 2022, there were 5,405 people in jail, marking a 13% decrease compared to the September 14th peak. The board is encouraged by the prior decreases in the jail population and believes that additional decarceration efforts are urgently needed. The people who were in jail on January 3rd included 4,935 people in pretrial detention, 148 people in city sentence, 100 people held on technical parole violations with no open case, 222 people in custody for other reasons, 738 people age 50 and over, including 29 of those who were held solely on a technical parole violation. On April 5th, 2021, CHS added vaccination metrics to its public data snapshots. In July 2021, CHS made a change to its vaccination reporting. Prior to July 23rd, CHS reported the total number of patients ever in custody who received the first vaccination dose by CHS, and separately the total number of patients ever in custody who completed vaccination by CHS. On July 23rd, 2021, CHS began reporting the total number of patients ever in custody who received at least one vaccination dose by CHS because patients in custody are increasingly receiving one dose of a two-dose regimen from a source external to CHS. Between January 7th and January 2021 and January 4th, 2022, CHS administered at least one vaccine dose to 4,513 people in custody. The number of new vaccine doses administered by CHS spiked in October and has since leveled off. In December 2021, the share of people in jail who had received one dose of the vaccine fluctuated between 44 and 45%. The share of people in jail who had been completely vaccinated fluctuated between 32 and 38%. As of January 4th, 45.2% of people in jail had received one vaccine dose, and 38.6% of people in jail had completed their vaccination. We now turn to DOC and CHS to provide their updates on the spread of COVID.
Commissioner Molino, it's Patsy Yang. Hi, welcome. I don't know if you want to take this first, or do you want us to?
I'll let you guys take the lead on it.
Sure, thanks. Patsy Yang, Correctional Health Services. Appreciate the continuing interest on the part of the board in COVID. I'm a little perturbed about the agenda language, which has already decided that we have a low vaccination rate among people who are incarcerated. I just want to say again that on its own, Correctional Health Services, back in the height of the pandemic, when the first wave, we were successful in securing state approval to offer a vaccine to people in custody. We were the first in the state of New York, and for a very long time, the only correctional system in the state of New York to offer that level of protection. And we continue our efforts at this point in time. Appreciate, Amanda, your summary of our data, just to bring people up to date. It is still about 45% of people who are currently in custody who have received one dose of the vaccine. That number really stays around 44 or 45%. What I want to emphasize is that while CHS has vaccinated over 5,400 people, About 60% of the people we vaccinated have been discharged into the community. So while the 44 or 45% number looks like it's the same, it does not mean in any terms that we're not continuing to vaccinate more people. And in fact, they're leaving jail and going back home. In fact, sometimes partially or fully protected against COVID, thanks to our efforts in partnership with the department. Of the 45% of people who received at least one dose of the vaccine, 39% of them, people who are currently in custody, are fully vaccinated. That means they completed their vaccination shots or their series and/or have additionally gotten a booster. 85% of the people who are currently in custody who are eligible for completing their vaccination series have in fact completed that. About 100% of our patients who are 70 years of age of older, who are highly vulnerable, are in fact fully vaccinated. 34% of the people currently in custody who are eligible for a booster have actually received a booster from us. So I think those are just facts that I think should be out there, given your assessment of our vaccination efforts. We continue to offer education and vaccination at every point in contact, beginning at intake, through the new admission process, at clinical encounters, with the support and partnership with the department, are able to offer points of vaccination in each jail. People who wish to have a vaccine are able to call the triage line and request that. We maintain a list so that we know who we haven't been able to reach yet. So when we go to that jail the next round, we can get to them. So that's really sort of it. The number of positives in jail, as everyone sees, is mirroring pretty much citywide. In fact, I think in the jails we're sometimes a little bit ahead of the rest of the city. We were for a good period of time back in 2020 and 21, it's a bit blurry, below the city's rate of positive COVID results. Back in early December, we surpassed the city rate. But a little over a week ago, we began to drop and bend the curve back down under the rate of the city. We are still offering testing to our staff. Our cornerstones since 2020 remain testing, cohorting, and vaccination. Cohorting is a huge part of our containment that cannot be done without the partnership with the department in terms of quarantining or medically isolating people according to what their risks are and where they are in the COVID spectrum. The rates of testing acceptance at intake is very high, which gives us a sense of what's happening in terms of people who are newly entering our system. The vaccination among our staff, we are a healthcare entity, so we are subject to the mandates, some of which the state is currently considering as I speak. We had 100% of our staff who are currently working at the time that the mandate deadline came upon us. 100% were in compliance, but because people are coming back from extended leaves, our numbers are something like 99 point something, but we are working actively, and people who are not in compliance with the state and city mandates are not actively scheduled to work. I think that's probably about all in terms of an update at this point in time, and happy to take questions.
Thank you. I have one or two questions. First, I just wanted a clarification on one of the stats you mentioned, which was, I believe you said that 89% of the population eligible to be fully vaccinated was, or so. I just wanted to make sure that I understood what that 89% is. What's the total and what does it represent? And then I'd also like to understand at the various touch points that you have and points where vaccination is offered to people in custody. are you seeing a higher rate of acceptance or uptake at certain touch points? And if so, how is that leading to any possible changes in your approach? Are there specific points at which you are having more success in administering vaccination and other points where you're not seeing as much?
Yeah, Jackie, thanks for the question. It's 85%, not 89. If I got muffled in my speaking, 85% of people who are currently in custody, who are in fact eligible for their second shot, for example, if they got Pfizer, at the time, and we don't count people who don't meet that timing yet. So of the people who are eligible to get that, to finish their series, they actually have completed that.
Okay, thank you.
If that's helpful, right? And in
Can I
terms of,
ask you a question about that?
Sure.
When people leave, are we connecting them to a place where they can go and easily get whatever they need to get, you know, the second dose, the booster, whatever it is? And because it's become very complicated out there.
Yeah, it has been. Thanks, Steve. We do, you know, as part of our reentry support service, provide people with information on where they can get their vaccinations. A lot of that, not surprising to you, is a lot of the public sites, the health and hospital sites. We also have our point of reentry and transition services practice. So those are our port practices, both at Kings and Bellevue, but also our port line, where CHWs who have established contact with people, in fact, we establish contact with our patients from the day they're admitted, and maintain that for reentry support. People can always call with any questions, issues, access. So we do provide that.
Thank you.
Yep. Sorry, Jackie, your second question. You know, we offer it. I don't think our experience is in gross terms all that different from what we see in the rest of the city, in fact, probably the country and world, which is the people who have signed on early or been persuaded or have since come upon an understanding or information, changed their mind and accepted the vaccine, are the ones who are coming in for the boosters. They're the ones who wanted the second shots. The percent of people who want that first shot varies. It's not by location or point of contact. It certainly is. We continue to educate and inform people, believing that it is an issue of information and time and persuasion that is the key. It's for people who are reluctant. Yeah, I mean, the people who want the first shot, it was obviously a lot higher back in 2020 when the vaccine first came out, but awareness and anxiety and concern, rightfully so, about this, what was at that point new and was probably less of a COVID fatigue question, and was certainly a more severe clinical disease. I think motivated a lot more people to get vaccinated. It was also a large population of our patients who, you know, haven't changed all that much to get vaccinated. So that 45% includes a stable population as well. I don't know if that helps, but.
Thank you. Dr. Cohn?
Yes, I have a few questions. Could you, I'll do one at a time. Hospitalizations over the past 6 months, and people on ventilators in the past 6 months. How many have there been?
Yeah, we I think like the rest of and I'll let Ross take this. You know, we're seeing, thankfully, very thankfully, milder disease. That's really been our watch. Hospitalizations for COVID have gone down. Right now we haven't had any COVID hospitalizations for a while. We have had hospitalizations where because the system obviously tests, it's been incidental, but I think that is reflective also of what's happening in the community.
Okay. What vaccines are you offering?
We still have Pfizer is primary. We do have J&J around. We have some Moderna for particularly Rosie's, where the patients who reside in Rosie's have been going upstate, and the state uses Moderna.
Okay. Are you still giving J&J, given the reports on thrombosis and efficacy?
We suspended it with the most recent information, but you know, nobody's insisted on it either.
Yes, that's great. Thank you. You mentioned that the uptake in vaccines on intake is high. Could you quantitate that for me? When I've tried to look at how many people are enter the system per month and how many people get vaccinated, it seems like there are probably about, I don't know, 500 people a month who come in, and
yeah. Let me clarify that. It's really that the consent for screening, for testing, is very high on intake. When on intake, we don't, at the intake exam, administer the vaccine. So, you know, people will say yes, but what actually happens when we come around and offer that is a different question. And we're not tracking that by, you know, did you say yes at intake, and then did you follow through at that point in time? So,
you're not
I misspoke.
Okay, the nurses are not giving the vaccine at the time they are doing intake?
During the new admission process, yes.
We do have it available, but I think to Patsy's point, you know, new admission to jail, as you know, Bobby, is at the end of a long road for people, and the actual uptake of the shot in that moment is low. Whereas with the new admission population, because they're people that we haven't spoken to about it before through our outreach efforts, we do have a higher rate of uptake, you know, to the extent that they're cohorted and we can reach them during that time period.
And what is that number? What is that rate?
I don't think
we don't break it out that way. It's just our anecdotal experience of focusing on, you know, primarily in EMTC versus the jails where we've been back and spoken to people, you know, dozens of times.
I would be helpful to know, for you to know, what the rate of uptake in intake is of vaccine, and if that's great, that's great. If it's not as great as you hope, or it changes, you could affect that. Additionally, I recall that a year ago you were going into housing areas, and not a year, well, you know, with early vaccine availability, and you know, and Patsy, you're absolutely right. That CHS was, you know, was early, almost in violation of the governor's policy, which he did not allow incarcerated people to get vaccines when any other cohorted population was able to get vaccines. But at some point early on, when vaccines were available, you went into housing areas and gave people vaccines. Are you doing that now?
Thanks for that nod on being the first and possibly risky. But we are not currently doing roving teams. We suspended that for a period of time when the challenges to the department staffing were particularly acute, to the, you know, out of safety for our own staff. It's not off the table. You know, we know that is an effective way to reach people and really have a good conversation with people. And so that's not off the table. It's just not happening right now.
Well, I hope that can be instituted as quickly as possible, and you can get the support from the department for the security necessary for that as well. I think I have one last question. I can't remember it. Thank you very much.
Sure.
Oh, actually, it was, if you could please include the booster data in your snapshots.
Jeanette Merrill's agreeing. She's the one who's got to do it. So yeah, that's a yes, Bobby. Thank you.
Okay, thank you very much.
Are there any other questions for CHS?
I did have a question. First, I just want to really commend and thank both CHS and DOC for how incredibly hard you've been working on this for almost 2 years now. I know that the numbers are much higher than anyone would like to see, and know you're taking that seriously, as are we. And understand the tremendous amount of coordination and intense focus that this is taking, even under normal circumstances, but especially now with the additional staffing challenges. It was mentioned earlier, I think this was in the commissioner's comments toward the top, that you've now had to open, I think for good reason, COVID housing in all of the jail facilities. And I know that having that additional capacity is really important for being able to move people who are diagnosed as confirmed COVID positive as quickly as possible. Can you speak to this, really a process question, kind of what is the process when someone is diagnosed positive, and how quickly are you able to move them into isolation? I think especially given the issues that were had back in the fall with OBCC and the potential exposure of so many people in the intake process. So what changes have been made since then? And generally, how are you monitoring the expedient transfer of confirmed COVID cases, people with confirmed COVID, to isolation housing? And I think that's a question really for both CHS and DOC, since it involves both agencies.
I'm going to ask, go on. Sorry, you take it, DOC.
You may go first, Patsy, and then I'll join in.
Hi, good morning, Chief. Yeah, I was going to actually ask our Chief Operations Officer, Carlos Castellanos, to just explain the start of the process. When we got somebody who needs to be moved, who's been exposed or is positive. Carlos.
Good afternoon, everyone. So the process really starts when a person gets confirmed, and the medical team provides DOC with a disposition, which would indicate where the person needs to go next. At that moment, the department, different units in the department gets notified, in the facilities, custody management, transportation, and they will then determine the timing on when the person needs to go into CC housing at that moment. So that is the start of the process. And again, it's a constant communication with the department throughout the process, where we all stay in contact just to make sure the person makes it to the housing unit that is determined on a timely basis. If you want to add anything else, Chief Presley, okay, Stokes.
This is Chief Stokes. I would just like to add that what we have done, and we have seen a significant improvement in this process with regards to transferring persons timely after the department has been given notification of a person testing positive for COVID. That is managed through CMCU, which is supervised by Executive Officer Sanchez and under the purview of Chief Lemon. Of course, we requested and we got agreement from CHS that this report is generated every 2 hours. It is followed by my office, which manages this process along with my other chiefs. Each day, we have dedicated groups to move persons, whether it's into facility or either it's to CDU. Chief Presley manages that operations. As it pertains to inter-facility transfers, the facility needs some assistance because there are times that people are non-compliant. We do send people to support the facilities, And each day at 16:30 hours, I chair a meeting with all of the facility leadership and the chiefs to just monitor the movement of all persons, whether it's to CDU, interfacility, to any other COVID unit within any of our facilities. As you stated, we opened up a COVID confirmed unit in all of our facilities. Some of the facilities are having 2 units.
Thank you very much, Chief, and thank you, CHS. And so you mentioned that the reports generated every 2 hours. Are movements happening within 2 hours?
Hi, Fred, this is Carlos. So the report goes out to DOC every 4 hours, but on that report, we flag any person who's been pending housing for more than 2 hours. We worked out a process with DOC where it asks us to code persons according to the time that has passed, and then custody management and the different units with the DOC will, manage that separately from that notification.
To add, when there are times where a person, the time has elapsed for some other time, it is not at the fact that DOC staff is not able to facilitate the actual transfer. There are occasions when we are getting non-compliance from the patient, and it requires some time for people to speak to them and provide them with some education regarding the virus and movement, and subsequently resulting in some level of compliance.
Tell us, have you changed your quarantine policy in terms of length of time in quarantine following the CDC recommendation of a week or 2 ago? Excuse me?
Hi, it's Ross McDonald. No, Bobby, we don't understand that guidance to be recommended for congregate settings. So we are still going with 10 days.
I think that's reasonable.
Can I just ask, with respect to, so CHS reported on vaccination among CHS staff. Could the department also report on vaccination among department staff, as well as any actions, if any, have been taken with respect to staff who have not been vaccinated at this point?
Thank you for that question. After looking at the data as it pertains to our uniform staff and the mandate, the vaccine mandate, 85% of our uniform staff has provided documentation of at least receiving 1 dose of that. As our continuing efforts to educate staff, we still continue to message to our staff members the importance of getting vaxxed, as through our town hall meetings, roll call briefing, and through our DOC internet portal. We continue to provide COVID testing at GMBC on Mondays through Thursdays, which is 6 days a week from 6 a.m. to 9 p.m. And COVID-19 vax, I'm sorry, the testing is what I was just speaking about in my first statement. I want to correct myself. Testing continues to be available to our staff at GMBC on Mondays through Thursdays from 6 a.m. to 9 p.m. And the vaccination, including boosters, are available Mondays through Saturday from 6 a.m. to 9 p.m.
Thank you. And can you speak to the efforts underway to bring that 15% of the staff who, as I understood what you said, the 15% of staff who are not yet in compliance with the vaccine mandate into compliance?
Our efforts continue to be, messaging, and educating. This latter group, of course, is, the person that we would suspect will be the hardest to, educate with them to willingly comply, with this, vaccination. It is just important that, we continue to make efforts to encourage them to get back so that they could, return to work, and advise them that it is just not for their own safety and well-being, but it's, for the safety of their staff members and their community.
So I just want to add, though, there are a number of those members that are evaluating reasonable accommodation requests, and some may have some issues medically as to why they can't receive the vaccine, and that reasonable accommodation process is ongoing.
I'm sorry, I didn't quite get all that. Back in a few weeks ago, the Post reported that 500 CEOs were put on suspension because they did not get vaccines after the deadline. How many are now on suspension, unpaid suspension for not getting vaccinated?
What has happened, Bobby, thank you for the question, is we have seen improvements of the number with regards to members who were not vaxxed or provided confirmation at the effective mandate. Currently, as we have progressed, and as I said, continue to message to staff and educate the importance of the vax. As it pertains to data as of yesterday, we had 108 correctional officers who's on leave of absence without pay as a result of not receiving the vaccination or providing documentation to the department, 5 supervisors, and 1 assistant deputy warden.
I mean, this is a question that may be difficult to answer, but it's sort of important to the present and the future of the department. Do you know why the staff of the Department of Correction had the lowest vaccination rates of any department in New York City? What would account for that?
It's a really hard question you answer as you preface in your question. I think our staff and our employees are no different than the hesitancy you see in the greater community. So we continue to message, try to educate for those that can medically accept the vaccine. And we're going to keep trying hard to convince them that we want them to be safe and their families to be safe, and their coworkers.
Thank you.
Just going back to the issue of accommodations and accommodation requests. How many accommodation requests are currently outstanding or pending? And for that number of folks, are those people working while their requests are pending, or what is their status while their requests are pending?
I want to say that number is approximately 500. Yes, those individuals are still working, and are getting tested weekly to ensure that they're not COVID positive.
Thank you. Are there additional questions? If not, thank you, and we will move into the next agenda item, the Nunez monitors report.
The Nunez monitor filed the 12th monitors report on December 2021. The report covers the period from January 1st to July 30th this year and was supplemented to highlight more recent security issues and judicial orders. The monitor found that the department's work to address the serious conditions that give rise that gave rise to the consent decree have been unsuccessful because the department lacks the most basic building blocks to reduce unnecessary and excessive use of force and violence. So the report lays out guiding principles for reform, the need to change from within with assistance from outside experts, the need to prioritize flawed security practices and procedures, inadequate supervision of the line staff in the jails and facility leadership, ineffective and inefficient staffing practices and procedures, and limited and extremely delayed accountability for staff misconduct. Security issues persist, including door security, over-reliance on probe teams, failure to act in self-harm situations, and failure to provide the basic services. The monitor found that use of force rates are still increasing and that young adults are disproportionately involved in use of force. 8% of the population, but they're involved in 22% of the incidents. The monitor attributes this to a combination of poorly managed staff in the facilities who are missing necessary skills and the young adults not having enough programming to minimize their idle time. The report also found that the rate of fights is increasing dramatically, and the department is on track to register the largest number of fights in a year since the consent order went into effect. Stabbings and slashings have also increased significantly and are more than double the rate of 2020. Assaults on staff have continued. Between January and September 2021, there were 2,113 assaults on staff, which works out to about 8 assaults on staff per day. We will now ask the department to present on the most recent Nunez Monitor's report.
Hi, good afternoon, everyone. Again, I'm Asim Rahman, Deputy Commissioner and General Counsel, and we appreciate the opportunity to comment on this report. Before discussing the report specifically, it's important to provide some context around the time of when this report was released. As you know, and as we've discussed today, in the second half of 2021, the agency was very much dealing with the impact of COVID-19, and we were deeply impacted by our staffing challenges. And as noted, during that second half of 2021, we also saw a rise in use of force incidents, fights, slashings, and stabbings in our facilities. That said, as the monitor noted in a December 1st letter to the court, quote, the department and monitoring team have been working at a breakneck pace to address the current situations. The monitor also noted that, quote, since the second remedial order went into effect 60 days ago, the city and the department have expended significant effort to address the dire conditions in the jails. In that December 1st letter, the monitoring team noted that DOC reduced the number of people in custody, that we took steps such as distributing tablets to reduce idle time in facilities, and they also talked about the gains relating to intake, DOC security protocols, and staffing. So while the department is still not where it wants to be, the monitoring team did note in that letter that, quote, the current situation is not as dire as it was in late summer and early fall. Several days after that letter, the monitor issued its 12th report. Like earlier reports, this report identified specific reforms, discussed the department's progress regarding those reforms, and provided a compliance rating. Certain reforms were given a rating of substantial compliance or partial compliance, while others were given a non-compliance rating. That said, this particular report was different from prior reports, and that's what we'd like to talk about with you today. First, as noted in the report, it was more streamlined. It did not contain a review of every single reform and requirement. Second, while this report covered the period of January 1, 2021 through June 30th, 2021, it also discussed, as was mentioned, certain issues and trends in the more recent months since June 2021. And third, in addition to the assessment of the department's compliance with specific reforms, The report opened with a detailed discussion on security indicators, and it identified 4 foundational issues that the monitor believes are stymieing reform efforts. As was just noted, these 4 issues are security practices and procedures, supervision of frontline staff, staffing practices and procedures, and accountability for staff misconduct. The report then provided a roadmap for what the department should do going forward. And these 4 foundational issues coincide with the 2 remedial orders that the court issued last fall. So what we'd like to do is explain some of the steps the department has taken to address those 4 foundational issues. Let's start with security practices and procedures, as well as the supervision of line staff. The second remedial order from last fall requires that the department develop and implement a security plan to address some of the ongoing security breaches that jeopardize security for both persons in custody and our staff. The department submitted a proposed security plan, which was approved by the monitoring team. And the monitoring team recently noted that the department has diligently rolled out these new protocols across facilities, and that this has led to some improvements in staff practices. That plan has several components. It includes the distribution of teletypes to our uniformed staff, which reiterate our expectations regarding adherence to policies, and the responsibilities of supervisors to ensure that line staff are adhering to those policies. These teletypes have been used at roll calls regularly to continue to message out the importance of this security protocol. The plan also includes the use of discipline, including the possibility of suspension for egregious security breaches that lead to serious injury. Another component of this plan is an assessment of key control in each facility. We're reviewing all post orders to ensure that they are updated and consistent with current policy. We're creating no-go zones to limit the congregation of incarcerated individuals near doors, and conducting audits of housing area management and supervisor tours. Currently, we're still implementing and rolling out elements of the security plan, but we believe it's consistent with best practices in the trade, and we hope that over time it'll lead to improvements in practices in our jails. In a subsequent to the monitor report, in the December 22nd, 2021 report to the court, the monitor also recognized that other reforms and initiatives in this area will require further discussion now that we have a new commissioner. Those include the appointment of the security operations manager and broadening the pool of candidates that we can hire to serve in our facilities at the level of warden or above. On the foundational issue of management and deployment of staff, the monitoring team has hired a consultant with deep correctional experience in the management and deployment of uniformed staff, and we've been working closely with this consultant in his development of a neutral staffing analysis so that we can get a more efficient picture of how we are utilizing our uniformed staff members. Also, as noted by the monitoring team, the department has made significant efforts to address the issue of unmanned posts and triple shifts. We have a new graduating class starting at the end of this month. As you've heard previously, we've been using NYPD to help staff our operations in courts, and the department has also made significant efforts to address staff out on sick leave and absent without leave, as discussed in today's meeting. And lastly, accountability for staff misconduct. The department has made very strong strides in the timeliness of its investigations of use of force incidents. As of December 15th last year, 96% of all investigations for incidents occurring between January 1, 2018 and October 31, 2021 were closed. However, with the improvement in completing investigations, a backlog of disciplinary matters has developed. While the investigatory backlog can be managed internally exclusively at DOC, staff misconduct involves several outside parties, and that impacts the timeliness of discipline. And that includes oath, union counsel, etc. Our staff have due process rights under law, and we can compel them to enter into negotiated plea agreements. As you may know, last fall, a third remedial order went into effect to address this backlog of disciplinary matters. And this new remedial order has several components that we've been working on. It requires us to get through a large set of disciplinary cases, known as the quote, priority backlog disciplinary cases, by April 30th, 2022. The remedial order increases the number of pretrial conferences before oath from 50 to at least 150 per month. The remedial order offered improvements in the oath process, including increasing the number of ALJs. It directed DOC to increase staffing in the trials division, and it created a disciplinary manager role at DOC. We have developed that list of over 400 priority backlog cases in consultation with the monitoring team, and we're actively moving them through the adjudication process. We have been aggressively recruiting and have attracted new attorneys and paralegals to the trial division, and we continue to engage in those hiring efforts. All told, these are some of the measures DOC has taken to address those 4 foundational issues noted in the 12th Monitor report. And this afternoon, as we mentioned, Commissioner Molina will be having a meeting with the Monitor team to help chart a path forward. Compliance with the Nunez consent decree remains a top priority, and we will continue to work closely with the Nunez monitoring team to address the department's challenges and issues. Thank you.
Thank you. Are there questions from members?
I have 2 questions. Who did you hire to be your expert consultant on security issues?
So the remedial order discussed hiring a security operations manager, and we are still reviewing our options regarding who those individuals will be. If it's one individual, if it's multiple, et cetera. Those are issues that we're talking actively with the Monitor about.
I'm sorry, you'd mentioned a consultant that you had hired.
It was on staffing. I had the same question about it. Was, I believe you had hired a consultant to complete a staffing analysis.
Yeah. Hi, and sorry, that's hired by the Monitor team, but Marshall, go ahead.
No, hi, I'm Assistant Commissioner Marshall Wolf of the Nunez Compliance Unit. So yes, there was a consultant actually hired by the monitoring team to do an assessment of our staffing levels in the jails, which include a detailed conversation with different units about how staff are utilized and deployed in our facilities. But that consultant is actually hired and falls under the purview of the monitoring team.
When will their report? When is their report due? And who is it?
I believe that the report is still being developed and finalized, and it needs to be shared first with the monitoring team.
It's a secret, the name of the person?
No, we can share the name of the name of the consultant is Tom Roth.
Thank you. And how many lawyers? You said you hired how many lawyers? A number of lawyers to assist this process that the Monitor is requiring. How many lawyers have you hired, and in what period of time?
So we continue to actively recruit. Just alone in the past few days, we've had 2 new professionals start this week. We had an attorney and a paralegal start yesterday. We have several more who are awaiting approval with OMB. We have 2 contract attorneys who we have brought on to help supplement those efforts. That's in addition to a few additional attorneys that we hired at the end of last year, as noted in the Monitor's December 22nd report.
And how many are you planning to hire?
The Monitor, in the most recent remedial order, asked that we hire 8 additional attorneys, and we're working our way towards that number. And we have gotten approval from the city to increase the salaries for some of these so that we can make the position more attractive. And we continue to aggressively recruit by conducting outreach to local bar associations, to law schools, and taking several other recruitment tactics to make sure these positions are filled.
Thank you.
Are there additional questions?
I have a couple of questions. So first of all, it's really tremendous progress that has been made on closing out much of the the backlog of the investigations, and also putting together a plan for bringing these cases to trial and working with Oath. I wanted to ask, I know you said that there were 150 cases per month that you have increased, worked with the city to increase the capacity at Oath to take 150 cases a month. Are you actually able to bring 150, or is that a number that you're working up to?
I think based on our latest numbers, we are on track to meet those conference requirements.
Okay. Like on track for this month, starting this month, you'll have 150 per month at Oath?
Yes, I believe that's the case. If I'm mistaken, we'll loop back offline, but the latest information I've seen suggests that that's what we're going to be able to accomplish in the month of January.
Okay. You had mentioned 400 priority cases that you had identified with the monitor to focus on. I wanted to just make sure we understood the full universe. So how many cases are currently just still in the investigation stage, so still open? And then how many have you completed the investigation but are still awaiting trial or some form of resolution?
So on all of these, the investigation is closed. These are all cases that are now in the disciplinary process. We can provide you with a breakdown of that number currently in terms of, for example, of their status in the disciplinary process.
Okay. Thank you. And just since we're on this topic, I'll just note, I know that in making this progress, the former deputy commissioner was really the lead on making sure that working with the monitor and with the other stakeholders to work on addressing the backlog and coming up with a plan for moving forward. So we look forward to seeing how the department plans to continue that work and just following up on the issues we raised earlier.
Thank you. See no further questions from board members. Department, thank you very much for your responses to our questions and for your presentation here.
Madam Chair, if I could just take a couple of minutes, I just wanted to also notify the board. Last Friday, we received some very sad news that former Commissioner William Frazier passed away. So we just wanted to send our deepest condolences to his wife, Ann, his daughters, Kristen and Casey. He was the chief of department during the time that this department contributed to the rescue efforts and responded to the attack on September 11th. So just wanted to share that with you, with the board. He'll be deeply missed.
Thank you, Commissioner, and the board adds its condolences to the family. Thank you. We are now going to move into the public comment phase of our agenda. I have a list of speakers who signed up to speak. I will call every person's name. When you hear your name, please raise your hand using the hand icon that is below the participants list on your WebEx screen. If you don't see the participants list, click on the silhouette of a person on the menu at the bottom of your screen. Once you open the participants list, you should see the hand icon in order to raise your hand. When you raise your hand, we will unmute you and you will be able to turn on your video. You can then begin your public comment. I will tell you when 3 minutes have passed and we will move to the next speaker. The board also welcomes written comments. You can email written comments to boc@boc.nyc.gov or mail them to us at 2 Lafayette Street, the 12th floor, room 1221, New York, New York, 10007. And I will now call our first speaker. That is Natalie Fiorenza. Natalie Fiorenza. Good morning, Ms. Fiorenzo.
Hi, can you hear me?
Yes.
Yes, okay, sorry, the tech takes a second sometimes. Good afternoon, everyone. My name is Natalie Fiorenzo, and I'm a corrections specialist at New York County Defender Services. I'm here today to speak to you again about our unanswered cries for help. At NYCDS, it's my job to field all concerns related to our clients' custody in Department of Corrections facilities. And I can certainly tell you that our clients have not seen any improvements in the past 7 months. Frankly, the conditions are just getting worse. The most imminently concerning of these issues appear to be the prevalence of unchecked violent chaos and the lack of access to emergency, let alone basic medical care in DOC facilities. In terms of the violence that our clients are living in, the bottom line is that there is no control and thus no safety on Rikers Island. The corrections officers are choosing their favorite detainees and awarding them with special privileges, such as time outside after lockdown, extra food, and actual protection. One of our clients shared that when he is getting attacked, the guards will watch and literally do nothing. But if the guards' favorites, who are picking the fights with him, are losing, everyone is sprayed to break it up. This may sound like speculation, but we do have proof. We have already seen video footage corroborating fight clubs, cameras that are blocked off and ignored, and impartial COs watching it all. This has been reported on by the media, and we are in the process of requesting more video footage of the new events that our clients tell us about every day. What more proof do you need as the board to do something as the only overseeing body for the Department of Corrections? Our clients are getting beaten, forced to fight, stabbed in the head, all right under the noses of passive guards. Even our clients who haven't been personally attacked know violence is a regular occurrence. When I ask them, do you feel safe? The response is the same every single time. If somebody wanted to hurt me, they could. The guards are nowhere to be found. Beyond the violence is the blatant violation of access to healthcare. When a client tells me they need medical attention, I send out a referral to Correctional Health Services, which is in turn forwarded to the specific facility. But this referral that I make actually turning into our clients being seen at the clinic is extremely rare, and they're becoming sicker because of it. This is beyond concerning, but what is horrifying is that this is happening for our clients with severe, sometimes terminal illness as well. This is happening for one of our clients who is housed in NYC, which is the infirmary facility whose sole purpose is to provide specialized long-term medical care. He suffers not only from pancreatic cancer and cirrhosis of the liver, but also hepatitis C, polio, anemia, and much more. That client is not getting medical attention. We have another client who's been urinating blood for over a month, which is a likely symptom of bladder and pancreatic cancer. For this last client, I actually was able to speak to a doctor at his facility to beg him to see him. And his response was, I need to see him. This man needs to be brought down, but they never bring him. I know about him. You need to talk to DOC and make them bring him down here. We at NYCDS are asking today for reporting on medical appointments, specifically how many sick calls are made by clients, how many referrals are made to CHS by advocates, how many clients are actually in the clinic being seen by a doctor, and how many missed appointments are there. The bare minimum of standards is not being met for our clients, not even close. The only solution here is decarceration because the Department of Corrections cannot take care of these human beings in the most basic ways, let alone the more severe. We as public defenders are up against a lot. The mayor's office and the courts are fighting against us every day. We need a truly united and concerted effort to make these changes. We need your support. We need something that can't be ignored. Thank you.
Thank you. The next person to testify is Kayla Simpson.
If I can interject just before Ms. Simpson begins speaking, I did want to say to the advocates who are testifying about specific people and specific cases that they should contact me about those people, certainly after the meeting, but in general, that you can make a complaint with your client to the Board of Correction.
Thank you, Ms. Masters. You may come to regret that. My name is Kayla Simpson. I'm a staff attorney at the Legal Aid Society's Prisoners' Rights Project. It's good to be with you. Good afternoon. Welcome to Ms. Richterink, Commissioner Molina. Of course, today is a new year, new mayor, new DOC commissioner. But as we think about the current crisis and how to actually address it, I think we have to be clear-eyed about the fact that we've now had 4 commissioners just in the life of the Nunez consent judgment alone, and many, many changes to the top of the hierarchy. And I also want to be clear, given some of the Nunez conversation today, I'm one of the counsel to the plaintiff class in Nunez. The moment that we're in is not because of this crisis. It is exacerbated by the crisis. The Monitor's 12th report makes the startling observation, some of which Ms. Masters noted, that, quote, the department simply lacks a crucial and basic level of capability, competence, and adherence to foundational correction practices. This isn't new. Not even breakneck effort within this system that we're in will fix it. And the Monitor describes, quote, decades of poor practices in which deficiencies are normalized and embedded in every facet of the department's work, reports new record highs of violence with every passing report. This is a system increasingly operating outside the rule of law, and that should alarm all of us. Line staff have received the message that there is no real consequence for ignoring the rules. There are 1,842 cases where the department has found objective evidence of use of force misconduct that are still pending. The minimum standards created to bring decency to incarceration are not met. In the case of RMAS, they're willfully defied. And the people who are paying for it are the people held in the jails. When you talk to them, you hear that price is missed meals, missed medication, missed medical or dental care, months without stepping outside or hugging a loved one, a daily fear for safety, seeing death. We've had month after month and heard again today that these items are top priorities, but those assurances are divorced from reality and they do nothing to abate that real suffering. We can't accept this. We can't accept conditions dramatically below minimum standards or mass staff absenteeism or record violence. We can't accept a willful rejection of BOC rulemaking for months that keeps punitive segregation open, ignores due process and caps on time and restrictive housing, the very things that this board and the public labored for years to eliminate. So what does this moment mean for the board? First, in regards to COVID, the board should be issuing evidence-based recommendations immediately about what the city needs to do to stop jails from being a human warehouse for infectious disease. COVID's been with us for 2 years, and I know we're all exhausted, but it is not an excuse for this chronic flouting of the board's minimum standards, nor are variances from those minimum standards the answer. Instead, the board and all of us must get the department what it needs to meet them. Second, please issue notices of violation when the standards are violated. For RMAS, for medical care, for recreation, for meals. Third, we need and we appreciate board staff in the facilities and watching Genetech footage. But then what we need is public reports on what they are seeing. The board COVID weekly report is incredibly valuable, but what we have been missing from the board for months is reporting on conditions. You have unparalleled access. We implore you to use it. And finally, we appreciate vigilance in these meetings to make them substantive tools for transparency. Engage facts, bring us facts, and then carry them as context into subsequent meetings. Please don't allow the agencies to reset the clock every month and defer answers continuously. Because the truth is, and we say this as public defenders who see this.
Please wrap up, Ms. Simpson.
Yes, ma'am, will do. That decision makers in the city have been too often willing to let the crisis continue. And so that necessitates that we continuously expose those realities. Thank you very much. I appreciate the time.
Thank you very much. The next person to speak is Ashaki Antoine. Good afternoon, Ms. Antoine.
Good afternoon, Ms. Sherman. How are you? Happy New Year to you and your fellow board members. Good afternoon. My name is Asaki Antoine, the first citywide trustee of the Correctional Officers Benevolent Association. I am also a correctional officer. For the past 2 years, I have expressed to you all the daily challenges correctional officers are facing in each and every facility. What I do not understand is the selective activism by you, the BOC, the city council members, and the inmate advocates. You all put your activism into ending punitive segregation, but they're not the same activism for the women in the jails who are sexually assaulted and sexually harassed daily, who, I may add, look just like me. And definitely not the same activism to protect correctional officers from physical assaults by inmates. I perused the Strategic Operational Restrictive Plan dated December 2021. You are tasked with guarding the safety and the well-being of people incarcerated in New York City jail system and of the staff who worked in the jails. Again, I guess the latter does not apply for correctional officers who look just like me. Inmates are covering the cameras to commit violent acts while detained. Inmates are slashing and stabbing one another. Inmates are violently assaulting correctional officers, resulting in broken eye sockets, head injuries. Inmates are brandishing makeshift weapons on Gentech videos to carry out random acts of violence, to threaten, bully, and to disobey inmate rules while detained. Inmates are groping female correctional officers' breasts, vagina, buttocks, and harassing staff daily. It appears that this behavior is acceptable to all of you. Where is the concern for the women affected by these assaults and the accountability aspect for the blatant disregard of inmates' rules while detained? Why are you not ensuring that this happens? Why isn't this a BOC priority? Violent inmates need to be separated from non-violent inmates and held accountable for their actions while detained. To place the blame on correctional officers for the failed practices for the past 8 years and most recently the past 6 months is most definitely repulsive. I'm hoping to start the new year, you all do a better job in protecting everyone in the jail setting, not just a selective few. Thank you.
Thank you, Ms. Antoine. I believe I speak for the entire board in saying that we take everyone's safety in the jails very seriously. That includes correction officers and other DOC staff, that includes visitors, that includes people in custody. I will next call on Kelly Grace Price to speak.
Ms. Price will join, was moved to the, and we can go to the next speaker.
Okay, the next speaker is Julia Solomons.
Hi, good morning. Just starting my video. Good morning. My name is Julia Solomons. I'm a social worker at the Bronx Defenders. As mentioned, this meeting is the first of a new year, a new administration, and what could be a time for change and renewed dedication to improving the horrific conditions in our jails. Unfortunately, however, our clients in custody are beginning this year with fear, anxiety, and ongoing denial of their basic human rights. And in terms of changes and implementation, we seem to only be moving backwards. With regard to COVID concerns, we appreciate the board's questions around vaccination rates, but we also encourage you to take a step back and ask the department for basic information around PPE compliance. Our clients report essentially no PPE or adherence to COVID protocols, and I personally haven't seen a client appear in arraignments for a court appearance or for a video conference with a mask even once since the Omicron surge began. Our clients report asking officers for masks and being told they have none to give them. Additionally, negligible access to recreation and time outside is one of the most regular things we hear from our clients, with many, many clients reporting months without any access at all to recreation or time in the yard, dating back well before this latest crisis and executive order. At AMKC in particular, these complaints have been regular for at least the past 2 years. So when the department says they're committed to providing people with these services, it's very hard to believe them. We hear similarly long-standing reports of denied access to law library, a critical resource that our clients rely on to participate in their own defense, and one that is illegal to deny people in custody regardless of staffing issues. This also directly impacts the court delays that we continue talking about, as people can't review their case discovery meaningfully or get important documents notarized. And perhaps most frustrating is the inexcusable state of restrictive housing. At the last meeting, when DOC had already missed the implementation deadline of the rule, they assured the board and the public that they would be able to implement that system by January 1st. Today, we heard Commissioner Molina's vague statements that they're still working on getting a timeline in place and taking a look at the new rule. It's unacceptable. These are excuses. And as Board Member Cohen highlighted, pieces of the rule like access to legal representation are straightforward, and there is no reason for any further delays in implementing them. It's insulting to those who continue to suffer in punitive segregation and ESH, numbers of people that far exceed the 8 people in punitive segregation that Commissioner Stukes mentioned. For people like those that Councilmember Caban described in ESH, including clients of ours that have been lingering there for months, with extremely limited out of cell time, there's no hope for them on the horizon. We struggle with how to most effectively convey the urgency of action on the part of this board and how to say it differently each month or more creatively beyond, please hold the department accountable. We echo other advocates' requests for notices of violation and for more vigilant reporting on conditions. We do hope to work collaboratively with Executive Director Masters and certainly welcome the quarterly conversations that Commissioner Molina alluded to and ask that those begin immediately. Thank you.
Thank you very much. I will now call on Danielle Gerard.
Thank you, Chair Sherman. Can you all hear me?
Yes.
Thank you. My name's Danielle Gerard. I'm a senior staff attorney at Children's Rights. Since 1995, we've been a national advocate for youth in state systems. We're also a member of the New York City Jails Action Coalition and the reconstituted Young Adult Task Force. We focus on welfare of young adults and youth at Rikers. Ms. Masters and Dr. Cohen raised concerns about services, and I'd like to emphasize the inadequate amount of food, a major point that young adults raised with us when we met with them, and a problem that surely represents an easy fix. The December Nunez reports describes the department's frequent use of force as a foregone conclusion to address any issue without consideration for other interventions. It states that conditions on Rikers have substantially worsened since 2015. The report also points out that young people are highly susceptible to the stressors of confinement and exhibit challenging behaviors while in custody. Staff who supervise YAs must have specific skills to effectively prevent violence and other types of disorder. We and all the advocates have requested this kind of training for years, well before and during both COVID and COBA's irresponsible and unconscionable behavior that continues with impunity. The report also points out that not only did the rates of use of force for 18-year-olds increase significantly from their already high levels, but so did the rates for all YAs. Rates were at or near all-time highs. YAs have a dearth of programming and an excess of idle time, which contributes to the frustration, chaos, disorder, and violence at the facility. This also has an easy fix. Children's Rights is alarmed by recent reports in the press regarding the treatment of solitary confinement as a laughing matter. Please consider the YAs and ESH and secure when you talk about solitary confinement. We emphasize that every incarcerated person, especially young adults, should always have a 14 hours lockout time. Any less is inhumane and does not lessen the violence rampant on the island island the very problem it supposedly addresses. Interaction with other human beings, including regular congregate program, is essential, especially to avoid adverse mental health effects for a population that already suffers high rates of mental illness. We need only of the tragedy of Khalif Browder. We fear the newly constituted young adult task force will not survive the current transition. We remind the board that the task force provides invaluable information and insight into programming, education, services, and reentry for young adults. We implore you to require DOC to maintain this committee. Finally, New York City spends hundreds of thousands of dollars per inmate per year. Surely incarcerated persons, especially young adults, not to mention the taxpayers, deserve that funding be spent both humanely and effectively. We know the solutions to all the problems raised today and in previous meetings. Please use your oversight responsibility to institute them. Thank you.
Thank you. I'll next call on Ann Goodman. Good afternoon, Ms. Goodman.
Good afternoon. My name is Ann Goodman. I'm a legal intern with the Urban Justice Center, and I'm here to read the testimony of someone who has been in a variety of forms of restricted housing recently, including types permitted under the new rule. I've been incarcerated on Rikers since March 2019, 34 months. I've seen everywhere on this island. The officers try to manipulate our behavior so that they can move us around and control us. They get someone to start a fight with you so they have an excuse to put you in the box. It's hard to move around so much because you don't get the services you need. I told mental health services I want to see them once every 2 weeks, but it's been 3 to 4 months since I last saw them because I've been moved around so much. At one point, when I was moved from one facility to another, I didn't get to shower for 3 weeks. I've been in every kind of restricted housing. This past year, I've only spent 3 weeks in general population. I've been in the box for 2 30-day periods this year, and 7 times in total over the past 31 months. When you're in the box, you're in a very small cell with a bed, a sink, and a toilet. You only get to leave your cell for 1 shower every other day. If the officers like you get to spend 1 hour a day in the day room with 2 other people. You all have your legs shackled the entire time. Being alone in my cell for too long made me a little psycho. I black out sometimes now. When I'm back in general population, I try to find some peace and quiet, which is hard. Sometimes I come to and realize I was losing it on someone, and I'm like, damn, what am I doing? It's like I'm physically there, but my mind is not. I shouldn't even be allowed in the box in the first place. I have chronic asthma and I'm prone to seizures. The medical staff took the asthma off my record, so in the system, I can come to the box now. The rest of the year, I've mostly been in enhanced restraint. Even though technically you're allowed out of cell time in enhanced, they make everything such a process to make sure you end up staying in your cell. In the most restrictive form, you're strip searched and shackled anytime you leave, even to shower. When you're not in your cell, they shackle you to a chair. They choose when you can leave and who can be out of their cell at the same time as you. Sometimes I don't even bother trying to leave my cell, even when I'm allowed to. Even in the less restrictive forms of enhanced, you still feel like you're a lab rat, like an experiment. The people who work here think that just because you're in jail, you're a bad person. Right now, I'm in a cell that has a metal cage attached to it. I can move back and forth between the cell and the cage when I want, but that's it. I want to help future people who might be put in conditions like this. That's why I'm happy to share this with you.
Thank you very much. The next person to speak is Claudia Forrester. Good afternoon, Ms. Forrester.
Hi, sorry, can you hear me?
Yes.
All right. Good morning. I'm Claudia Forrester, a jail services advocate with Brooklyn Defender Services. Today, I'm going to speak on the experiences in restrictive housing. We know that incarcerated New Yorkers across all housing units are suffering under DOC's extreme mismanagement, but the neglect being experienced by those in restrictive housing has only been accentuated by the inherent isolation of these units. Mr. C was in ESH level 1 for 6 months, with no additional infractions, no reviews, and no explanation. He shared that the hours out of cell in level 1 have become 15 minutes per week, just to shower. He essentially experienced 24-hour lock-in a day with no guarantee of an end date. When he was finally moved to level 2, after 6 months, the unit looked identical to PSEG. Even DOC staff referred to the unit as the box. And this is, quote, the mayor's experiment. Mr. C has been placed on suicide watch 3 times so far. Mr. H was recently moved back to punitive segregation after 2 months in ESH level 1, without any explanation, new infractions, or dispositions. When he asked why he was being sent back to the box, a captain responded, "You're going to be in these units for eternity." Mr. M shared that he has gone hoarse, calling for COs to get another individual medical care, to beg for his own medications, or for a booster shot. He described that there are feces and urine all over ESH level 1 as individuals resort to throwing their own waste to attract attention. Mr. H, who has been in restrictive housing for 4 months now, shared that he has been getting meals only about once a day and believes he has lost about 20 pounds since he entered restrictive housing. He further shared that he has stopped taking his psych medications altogether because he was only getting them about twice a week anyway. Mr. S is a young adult who calls his family daily. Neither his family nor his legal team were able to contact him for about 10 days, despite multiple scheduled video conferences and requests for urgent calls. We found out afterwards that Mr. S was being held on deadlock in a GP unit. For most of this time, he had no mattress and had to sleep sitting up on his bed frame. The only meals he received were what other incarcerated people shared from their commissaries. After 6 days, he started hallucinating from lack of sleep and food. During these 10 days, Mr. S had no access to the phone, counsel, or medical or mental health services. These are only a fraction of the experiences that are happening right now, every day in New York City jails. People are locked into their cells for up to 24 hours a day with no water, food, adequate heat, access to healthcare, or access to their loved ones or legal teams. We are continuing to isolate people, and it will only feed the crisis in the jails. Thank you.
Thank you. The next speaker is Irene Sedano. Good afternoon, Ms. Sedano.
Hi, good afternoon. Can you hear me?
Yes.
Great. Hello, my name is Irene Sedano. I'm a jail services advocate at Brooklyn Defender Services. PDS welcomes Luis Molina, and we look forward to working with you and your staff to address the ongoing crisis in the city jails. I'm going to list a range of experiences happening right now, issues that have yet to be addressed and give us grave concern for the health and safety of people in custody. Mr. A is at AMKC, where he and others are reporting freezing conditions, wearing layers of clothing to keep warm. Most of the cells have broken windows, and despite multiple requests for DOC to fix the windows or for the men to be transferred, DOC has ignored the seriousness of the situation. Men are left to fix the windows using plastic bags and toothpaste. This morning, it was 17 degrees, dangerously low temperature with no word or plan from DOC. Mr. B is in PSEG and is scared for his life, saying he isn't sure he'll make it out alive. He was recently assaulted and has several stitches across his face. People from other units are freely moving around and going into his unit with no concern from DOC staff. Mr. B, like so many others, say they've gone days or weeks without seeing a single correctional officer on the floor. DOC staff who abuse their sick time policy and refuse to work are putting people in custody as well as their own colleagues at risk. Mr. C at BCBC said he hasn't received mail from his legal team or loved ones in over 2 months. Our office has sent multiple documents to the jail for them to never reach him, and Mr. C is not alone. Across multiple facilities, we're told the same thing. There's no staff, or the staff assigned to the mail is, quote, on vacation with no other information. Mail is essential. Legal mail can be crucial for someone's release, and mail from loved ones are crucial for someone's hope and survival. Mr. D is in a dorm, high risk, and wanted to get tested. He has called the CHS hotline multiple times, left voice messages, and our office sent referrals on his behalf. And he tested positive for COVID. We know almost 500 people in custody are actively positive as of last week, and that's just who's getting tested. People are calling our office asking how to get tested, how to get a vaccine. They've reported they've tried calling the CHS hotline with no answer, no follow-up. Despite what we heard this morning from CHS, many people report calling CHS with no answer or learning they're not on the sick call list. And if they do make the list, there's no escort to take them to the clinic. In one case, someone was requesting a vaccine with no response from CHS. It wasn't until he went to the clinic for an unrelated matter and asked for a vaccine that he got one. In another case, a man at OBCC had requested a vaccine for months, and whenever it was scheduled, there was no CO to escort him to the clinic. The barriers for people to access services are only getting worse. People need information and communication from DOC and CHS about COVID testing and vaccine opportunities, movement protocols, mask and cleaning procedures. We have learned too much about COVID for us to repeat the same mistakes. 16 people died last year and conditions are not getting better. Thank you.
Thank you. The next speaker is Christopher Boyle. Good afternoon, Mr. Boyle.
You can hear me now? I think I'm on here.
Yes.
Yes, hi, my name is Christopher Boyle. I am the Director of Data Research and Policy at New York County Defender Services. I have been listening since this morning to the Department of Corrections talk about how things are either better or about to get better. I would refer to this as something like, I talk about, fires in your front yard and fires near your gas main. And they're talking about putting out fires in their front yard. There are 200 men right now at RNDC that are on a hunger strike since Friday night. I was in RNDC yesterday. I spoke to one of the gentlemen there. He says, we're committed to this hunger strike. It's 4 different dormitories that are there right now. As of last night, they had missed their 12th meal. I spoke to another gentleman who made a phone call to me after I gave my number out to the person that was speaking to me. So I then received approximately 14 to 15 messages last night of inmates who were participating in the hunger strike. I received another 3 this morning. These men are committed to the hunger strike because of the conditions, and it's the conditions that everybody's been talking about, which are just completely and utterly awful. Black mold in the bathroom, no rec time at all, no mail, no in-person visits for their families. There is one officer for 100 people. There's one apparently female officer that is in the bubble. They haven't seen a person on the floor in God knows how long, and no one seems to care. No warden has come by to talk to them. Nobody's having a conversation with them. Apparently now what they're up to is an officer came in yesterday and said, do you want food? Because we're not going to bother to bring it if you don't want it. And they said, no, we don't want it. And the officer walked out. So no food is being brought in right now. So I don't understand. I'm listening to this thing all day today. And I'm just flabbergasted at just the ability for them not to even know that this has been going on since Friday night and no one doing anything about it. Because if you've got 200 men that are committed to a hunger strike, you know that some of those guys are ill or diabetic. What do you think is going to happen in the next 24 hours when they're not eating? I just don't know what you are all doing when this is going on and nobody is doing anything about it. The new commissioner has come in, and the first two things that he did was to basically fire the person that apparently was doing a good job investigating what was going on the island and allowing the corrections officers to make it easier for them to call in sick. It's just amazing to me. I was one of the people that was on the writ where the Judge Neubauer had found deliberate indifference. I was in the courtroom and the Department of Corrections sent the lawyer to argue their case. And you know where he was? He was on Microsoft Teams in Queens, not even bothering to show up in the courtroom to argue their case. And then they lost and they were surprised that Judge Neubauer cut him loose. This is just unbelievable here. I am just amazed at the incompetent level of what's going on here. I really don't have anything more to say. Thank you very much.
Thank you, Mr. Boyle. I believe that we have one final person on the list to speak, and that is Kelly Grace Price. Adel, do you know whether Kelly Grace Price is available?
I do not see her in attendance. I think she was trying to sign in earlier, but she's not in here yet.
All right, if she is not available, I do not believe we have anyone else who has signed up to speak. That is the final item on our agenda today. Thank you, members of the public, advocates, for speaking today, for sharing your experiences and the experiences of people in custody. We take what is said extremely seriously and will work with you and with the department and with others to follow up. The board's next public meeting is scheduled for February 8th, 2022 at 9 a.m. We will provide meeting details on our website and send an email to interested parties. Without any objections,
I think Felipe raised his hand. I'm sorry. I think
Oh,
someone.
I'm sorry. I'm sorry. Felipe, did you want to speak?
Yeah, I wonder if the Department of Corrections wants to make a comment regarding the hunger strike we just heard about. It sounds like new news to you guys at DOC, or can you expand? Folks at Department of Correction, is there a hunger strike going on?
We don't have that information currently, but we are, I'm on the phone right now trying to get the information as quickly as I can. As soon as we get information, we'll communicate with the board.
We look forward to follow up as soon as possible. Thank you, Felipe. And without further objection, the meeting is now adjourned. Thank you very much.